Good morning, Guam. Well, I had my coffee this morning.
I need some more coffee.
Were you just channeling your inner Robin Williams there? That was
Yeah,
very
hello.
good.
Anybody who's ever done radio, Good Morning
Does that,
Vietnam.
yeah.
Yeah, so
That's like the gold standard of morning greetings. That
I
was
think
very nice.
That's how you say good morning.
Okay, I by no means would I ever want to upstage the two of you because you guys are the best in the business and everything. But we're a month exactly into this now, right?
Right.
I have a question, and I'm gonna seem like a total noob here, but when you wear the mask, is it the wire side goes on your nose, right?
Yeah.
Okay, because
You should put it on your mouth though and pinch it shut and.
but all the nuns in 6th grade at St. Anthony's, I'm sure would have appreciated.
Yeah. Where's
that
the
from me.
clothespin?
But I found that if you accidentally put it upside down,
Yeah.
it actually cradles your jaw better because
Wow.
it pulls it less down. So
Okay. So you're reinventing how to wear the mask
yeah,
this morning.
This morning in completely useless trivia.
Hey, let's say good morning to our guy Jason Salas. Of course, he's our digital tech guy. And good morning to everybody on our Facebook live feed. Of course, it's KUAM News Facebook Live, joined by Sabrina Salas Matanani. Good morning.
Half a day, ready?
It is containing COVID, and like Jason said, it has been 1 month since the governor first announced the 3 positive COVID-19 cases on March 15th. And, the day after that, the 16th, I think the 17th, everything got shut down, schools and stuff. So we're nearing 1 month, which is kind of crazy because it seems like it's been way longer.
Yeah.
I miss you guys. I miss life. Little things that we always took for granted, but you know what? Maybe that's why a lot of this is happening. Father Paul, I want to go back to what he said. The Lord works in mysterious ways.
Mm-hmm.
And there are things that I miss that I never thought I would miss, like being able to sit down in a restaurant and take your time eating your food.
Yeah.
Yeah, so, but it's all for a great cause. We're trying to save lives out here with containing COVID. And we got the latest deep dive into COVID-19 news for the day with Sabrina coming up. But first, we're going to tell you all the ways that you can catch the show live on the radio, 93.9 FM. And then we're also streaming live on KUAM.com and the KUAM News app. And we're on the Facebook live feed where want to, again, wish you guys a good morning. If you're watching around the world, type in where you're watching us from, and we'll do a little shout out. And any questions, comments, we do keep track of those kind of things, and we try and respond to real information real time. So if you do have any of those, shoot those up there. I know there's always a lot of questions about assistance, and we'll have info on that. I spoke to Dave Della Sola. There was a release that came out from Department of Labor yesterday, and he's anticipating that he will get the wage benefit amount today or tomorrow. He's waiting on the feds. Okay, and then remember 8 o'clock to 10 a.m. we go on to KUAM TV 11 where we take it to our TV audience, and shout out to all of our Manomko who are listening and watching, and thank you for joining us here on Containing COVID. It is 6:15 Wednesday on what would have been the tax filing deadline, April 15th. Remember that? Taxes?
Yeah.
Filing. And speaking of taxes and filing, we're going to get Daphne Shimizu from Revan Tax on here to tell us where we're at with the advance payments and the stimulus checks and all that good stuff. But first, let's take a deep dive into the day's COVID-19 news from the KUAM News team. Sabrina Salas Matanani. Good morning, Sabrina.
Off it, everybody. According to the latest from the Joint Information Center at 10:10 p.m., Public Health and Social Services tested 30 individuals for COVID-19 on Tuesday. 0 tested positive through Public Health. 30 tested negative. 1 additional case, however, was confirmed through DLS. To date, there are a total of 135 confirmed cases of COVID-19 with 66 recoveries and 5 deaths. All 64 remaining cases are in isolation. Despite a week of low single-digit coronavirus infections, it's no time to celebrate, says the governor. Her daily press briefing yesterday, she and Physicians Task Force member Dr. Felix Cabrera cautioned that we must stay the course.
Thank you, Governor. Half a day, speaking on behalf of the Governor. Half a day, speaking on behalf of the Governor and State Surgeons Physician Advisory Group. We would like to give the general public a brief update as to what current COVID-19 positive cases are telling us in regards to our ongoing projections. On April 3rd, we presented projections that include a range of possible outcomes, including our plausible worst-case scenario. In this model, the projected peak may not be until the first week of June. FEMA's own independent modeling has a projected peak as early as mid-May. Therefore, any discussions on Guam already being past our peak is not only extremely premature, but potentially dangerous. This is especially concerning as there is now growing consensus among the country's experts that COVID-19 has the potential to hit us in waves if we relax our preventative measures too early or too rapidly. Multiple waves, by definition, have multiple peaks. It would be irresponsible for us to believe that we are out of the woods or even close to it. It is very important to note that is a misuse of its purpose. Instead, they are a planning tool that describes a range of possible outcomes that are highly sensitive to our actions as a community. We must understand that these actions have significant lag time in what ultimately gets reported as new cases, hospitalizations, or deaths. If we act only on the best or most hopeful projected scenarios, we are likely to end up with the worst case scenarios. If we prepare for the plausible worst case scenarios and continue our resolve to strongly enact our early prevention efforts, we are much more likely to end up with a much better scenario. Lastly, it is important to realize that no country, state, or territory has yet to be over-prepared for COVID-19. If we stay the course and continue our mission, we can be more successful in decreasing the spread of coronavirus and thus saving lives. Thank you.
Dr. Cabrera has projected that the cases won't peak until at least June, although he says FEMA's projections have it by mid-May. The bill to add sanctions to the governor's stay-at-home executive order was sent back to committee. That's Bill 334. Sponsor Speaker Tina Muñoz Barnes spoke passionately in defense of her measure, while opponents such as Senator Clinton Rogel argued that it imposed further restrictions on our civil liberties.
I want to share with you, Madam Speaker, it is to give our island families the liberty to continue to go to the grocery store, the pharmacy, get dinner, but while reducing the risk of being exposed to COVID-19. And the only way to do this is to put measures in place to contain the spread of COVID-19. While I understand in my heart the many concerns, and I also comprehend that simply putting this bill aside would be the best thing to do politically, I would hope that we put our community and our island residents, our people first.
So I think adding any more restrictive measures to that is also difficult for the psyche of the populace as a whole. It makes people feel even more constricted and more confined than they currently are. And I think people need to know that what we're doing is working. I think they need to know that there is a light at the end of the tunnel. And I think they need to see a clear direction and a clear plan of where we go next from here, not just let's lock it all down, throw away the key, and then we'll figure it out later.
Meant to discourage unnecessary travel. She has pledged to continue the measures despite the lack of sanctions.
Which one's this?
Governor.
Oh, okay.
Combating COVID-19 has required me to exercise my existing executive authority to keep Guam safe. This includes the implementation of public health road closures meant to deter non-essential movement throughout Guam and educate drivers on the risk associated with violating clear public health directives. This is done with the support from the Guam Army National Guard and GPD. We are not the only jurisdiction to implement this measure. Road closures are currently being deployed in North Carolina. The difference between us is violating an executive order during a public health emergency in North Carolina is a Class 2 misdemeanor. which carries the penalty of up to 60 days in jail and $1,000 fine. No such penalty or fine currently exists in Guam law, even though it exists in nearly every jurisdiction throughout the country. So I ask a simple question. If someone knowingly puts your family at risk for COVID-19 infection, could you live with the knowledge that what they did was not punishable by law? This morning, our legislature debated the merits of making a public health emergency declaration more enforceable. While I do not know what they will do, I respectfully ask them to keep that question in mind. No new laws would be necessary if we simply took responsibility for ourselves. I'm sad to admit that my social media accounts have seen numerous examples of those who violated our social isolation directives this weekend, potentially placing themselves and those around them in danger. The effects of these social gatherings may not be felt until 2 weeks from now. This is what we mean when we say COVID-19 is a slow and long illness. Your decisions today, your choice not to social distance may seem inconsequential, especially if you are only looking at the rate of new cases. But this mindset kills people. Human beings have the tendency to overestimate the positive. Hope is a powerful thing, and while we surrender it, our decisions must be based on science and what we learn from those who succeeded or failed. In recent days, I have been cautiously optimistic about our fight against COVID-19. But for many, that fight isn't just about the number of those infected or treated at our hospital. It's about the basic struggle to find a job or keep a small business going. That is why
senators, they went back into their session at 2:30 in the afternoon and began debate on Bill 335, the legislation by Senator Amanda Shelton, which also gives the governor more power during a state of a public health emergency, allowing her to implement a curfew, which would apply to all island residents. It also would allow her to mandate provisions to stop the spread of COVID. During session, tensions reached a boiling point following discussions on an amendment that was proffered by Vice Speaker Talina Nelson.
It's a dilemma, or it's a bargaining tool to let her have curfew, to give her the authority to implement curfew. So,
point of personal privilege, Madam Speaker.
Please state your point of personal privilege, Vice Speaker.
The amendment are conditions if she wants to institute curfew. There's no bargain here.
Thank you, Vice Speaker. Minority Leader,
thank you, Madam Speaker.
please proceed.
So once again, this is a bargaining tool to give you curfew.
Point of personal privilege, Madam Speaker.
Oh my gosh, I'm calling it the way I see
Go
it,
ahead.
and if she doesn't like it, I'm really sorry about that, but it's
Minority Leader,
technically
please.
a
There's
bargaining
been-
tool.
Minority Leader, please. You are out of order. Vice Speaker, please state your point of privilege.
The amendment is a requirement that the governor must give to the people of Guam if she is to institute a curfew. It is not a bargaining tool. These requirements is providing a sure plan that we don't know about. It is not a bargain. There's no scheming here.
Thank you, Vice Speaker. Minority Leader,
Thank you, Madam
have the floor.
Speaker. Again, if the governor doesn't act on these 4 measures here, then she can't have the curfew. So if that's not bargaining, I don't know what is.
Vice.
So moving
Minority
forward,
Leader.
no, I have the privilege, Madam Speaker, to speak my mind. And when I see something that looks this way, I have the option to say so. It's just an amendment that's going to be placed in here, and it ends up that the governor won't even sign it into law because of this amendment. Maybe that'll be good. But regardless, I don't want to hide by anything or just be deceivious from it, so I'm just going to object to this amendment, Madam Speaker.
Point of personal privilege, Madam Speaker.
State your point of personal privilege, Vice Speaker.
In according with our Mason rules, you don't attack the person or the characters or the individual's character. It is completely out of line,
Thank you.
unprofessional,
Point of personal
uncollegial.
privilege.
Thank you.
I still have the floor, Madam
Thank you.
Speaker.
Oh my God.
To call this a deception on the record, it's uncalled for. Every single one of us makes amendments and adds requirements to bills to ensure that measures are taken. This information is not that we're putting out here on this amendment. This information is not being given to the public. And I didn't know that we could tell the future whether the governor will or will not sign something. All I ask is to be collegial here and to be professional.
Thank you, Vice Speaker.
Point of personal
Minority
privilege,
Leader.
Madam Speaker.
State your point of personal privilege, Minority Leader.
Thank you, Madam Speaker. And Madam Speaker, what I said was just truth. What I said had nothing to do with offending anybody or in anything. I see it the way it is, and I called it the way it is. So, thank you, Madam Speaker.
Madam Speaker, this amendment ensures that the people of Guam are brought forward if the governor should choose the need or should find the need to implement a curfew to attack this COVID-19 crisis. This virus is invincible. We see the previous speaker spraying her chair down and the desk because that's how serious it is with Lysol. So we cannot pretend like it doesn't exist.
Point of personal privilege. I have a 91-year-old father, so I'm taking precautions, Madam Speaker, because I'm here for the
Minority
people.
Emergency session continues at 9 o'clock in the morning. They are expected to continue their dialogue on Bill 335. In other news, the U.S. Secretary of Transportation, Elaine Chao, announced today that the U.S. Department of Transportation's FAA will award $20.6 million in airport aid to the Guam International Airport to help respond to the COVID-19 public health emergency. This historic grant funding is part of the Trump administration's newly created CARES Act airport grant program, which is an effort to provide unprecedented and immediate relief to American families, workers, and businesses. The Customs and Quarantine Agency, at the request of Public Health, requires the completion of the mandatory customs declaration regarding the importation of items related to COVID-19. This includes in vitro diagnostic tests, PPE, medical devices and supplies, antitoxins, serums, vaccines, immunizing agents, antibiotics, other pharmaceutical agents, and or ventilators. The intent at this time is not seizure, but to track these items as they arrive, as well as guard against the importation of counterfeit items. The Department of Labor is requiring all employers and business owners who have displaced workers to register on the department's virtual one-stop system, HireGuam.com. Employers and business owners must register their organization if they are experiencing business shutdowns, layoffs, furloughs, and reduced hours caused by COVID-19. This requirement is authorized by Executive Order 2020-07, in which businesses must comply with required reporting regarding reduction in workforce or employee hours. Again, that is HireGuam.com. In news from the CNMI, Governor Ralph Torres and the governor's COVID-19 task force, as well as the Commonwealth Health Corporation, confirmed 2 new COVID-19 cases, bringing CNMI's total confirmed case count to 13. An update on the USS Theodore Roosevelt. As of today, 93% of the crew members have tested positive for COVID-19 or have been tested for COVID-19, with 589 positive and 3,922 negative results. 4,024 sailors have moved ashore. 4 sailors assigned to USS Theodore Roosevelt are in U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors is in the ICU for increased observation due to shortness of breath. As we reported, one sailor died. His name has not yet been released. In national news, President Trump is defending his administration's response to the coronavirus pandemic and is looking ahead to reopening businesses across the country. But some governors are pushing back, saying that power resides within the states, not the federal government. Natalie Brand has more details from the White House.
President Trump is meeting this morning with people who have recovered from the coronavirus.
Thank you very much, everyone.
Monday, the president vigorously defended his response to the pandemic, even playing a campaign-style video during a contentious press briefing.
When you reported it. 0 cases, 0 deaths on January 17th.
The entire
January, I said in January.
Your video has a complete gap.
On January 30th.
What did your administration do in February for the time that your travel ban thought?
A lot.
And the president asked Dr. Anthony Fauci to clarify comments about whether delaying social distancing measures costs lives.
The first and only time that I went in and said we should do mitigation strongly, the response was yes, we'll do it.
The president is expected to name a new coronavirus council today. The team will be tasked with advising the president on reopening the economy and country, a decision the president says is his.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be.
The authority is
total. It's total. And the governors know that.
But many state and local leaders set the restrictions in the first place and say the Constitution gives them the power to lift them.
The president's position is just absurd. It's not the law. It's not the Constitution. We don't have a king. We have a president.
President Trump tweeted a response saying Cuomo's been calling daily, even hourly, begging for everything, and now he seems to want independence. That won't happen. Natalie Brand, CBS News, the White House.
Activities in literacy, math, and character education life skills for those students and families who do not have reliable or consistent internet access. These packets contain information and resources aligned with the weekly lessons and activities provided to students on the GDOE Home Learning Resource website. Due to limited staffing and availability of resources, each school has a specific distribution schedule. And you can find that schedule on our website.
All right, thank you so much. That's a deep dive into the day's COVID-19 news, 6:35. We're going to take a break. It's Containing COVID, KUAM-FM, Agatni, Guam. Good morning.
Para matutunan ni Departamentong Pulisiya, DWI na checkpoint siya.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. healthy. Be informed with ITD.
We're working hard to keep you safe. Wash your hands. Stay home.
Holiday, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
Boys in Mixed Plate, good morning. 1 month since the first positive COVID-19 cases.
I'm really digging the music.
Yeah, feeling it. You know, shout out to our local artists as we got another Stay Home Live Local Fridays coming up this Friday.
We sure do. I'm trying to think,
awesome.
who all do we have on the show? Do we have Chris Boomer? Chris Boomer, I think.
Chris Boomer, I think. Daryl Garcia. I know we got some Baba B.
Laddie Tones.
Oh, Laddie Tones.
Laddie Tones,
right.
Yep. Andrew Gumatauta does a killer Beatles song.
Go ahead. Give me a little sample.
Yeah, all right. 6:41. Let's get right to it. I want to get the minority leader on. I put out a feeler to the vice speaker's staff. If I had her number, I'd just call her directly, but you got to go through the staff. So hopefully she'll be able to call in. But the fireworks yesterday, I don't know if it was fireworks really, but minority leader Tello, just good morning.
Good morning. Good morning, Chris, and good morning, Sabrina. And yes, you read my mind. Oh, I love that song. I haven't heard that song in a long time.
I gotta say, I'm not trying to offend any Hawaiians, but poi is gross. I don't know what the deal is with people liking poi. I tried it when I was in Hawaii one time. No, sorry. Nope.
Ooh, Dr. Shea would be mad.
Yeah, and I lived in Hawaii for 3 years, and I tried it once and
that was it.
stomach the rest of it. Nope, that was it.
One hit a quitter.
One hit a quitter.
Okay, so Senator, let's just go back. Was this really? Was it a long day? Everybody stressed, and you used a word that the vice speaker didn't like, which was a bargain.
Yeah, exactly. And then she had to, during that whole fiasco, or the point of personal privilege that the speaker uses so, on every single thing she wants to make a point out.
What is that?
point of
Sorry, I'm sorry.
if
Can
you
we
go
just?
into the-
What is
yeah.
point of personal privilege? I'm naive about the
Personal
procedural
privilege,
stuff.
Okay, is basically in the Mason's manual that states that when a senator has a point of personal privilege, it's because they want to defend someone who has made a remark toward their character. Excuse me, sorry, it's early in the morning.
Right.
I was just clearing. Damaging their character, felt that they were
So it's a
insulted
sassback,
in some way. So it's based on their character. And when I was making reference to the bargaining chip amendment, she took it like I was attacking her character, which it totally wasn't. But it's her MO to speak over anybody else who's trying to speak on the session.
Who's
Point of
MO?
personal privilege.
Who's
The
MO,
vice
Senator?
speaker?
Vice Speaker or Speaker?
Oh, Vice Speaker. Vice Speaker. We all saw that last year at the beginning of the term, where she wouldn't let anybody speak when they're on the floor. She would always interrupt, use point of personal privilege, and use point of information, which point of information is to provide information, not debate on somebody's comments. So she's at it again. It's her amendment. So when somebody says something, she's using point of personal privilege, which has nothing to do. She was out of order. And the speaker, of all people, should know better. She's the presiding officer. She's supposed to know the difference between a point of privilege and point of information. And she allows, every time a Republican says anything, she cuts us off and saying, no, you're out of order. But when somebody else does it on the Democrat side, and it's obviously during yesterday's debate, she was allowing Senator Nelson to continue to, use the point of personal privilege when it doesn't even exist in her comments. So it was out of order. Anyways, the last section of it was when she did when she was ending on her amendment, she attacked my character. That's when I, came out and used the point of personal privilege correctly, because she was making a reference because that I'm using Lysol when I come into the session floor. I wipe my table down. I have my hand sanitizer right next to me, my Clorox wipes, and then I spray my chair, everything that in there on Lysol. I'm being very, very careful. I have to. It's not just for myself. It's for my father, who I'm his only, child here on Guam to care for. And for her to attack me because I'm being careful, like you said, right, Sabrina? We have to wash our hands, make sure we're all taken care of, not just for ourselves, but everybody else that surrounds us. We're doing our part in the community. And for her to attack me for doing that on the floor, now that was not called for.
Point of personal privilege, Senator.
Right, exactly. And
I know I had a point of...
And when I started to speak my point of personal privilege, the speaker decides to cut me off.
Yeah. I mean, but, it's partisan politics. We've seen it, how they, with Senator Moylan, with all the Republicans, it never seemed to get the time of day. But I think people watch and they see it, and they know that Speaker Tina gavels the minority, and gavels not just the minority. I mean, there are Democrat senators that, she runs a gavel on.
Yeah, Therese Trelawney.
And Sabina Paris, maybe. Right?
Yeah, maybe Sabina, not so much Sabrina, but...
But point of personal privilege, Senator, I got to say that we do the exact same thing when we come in here. We Lysol everything, and I don't have a 91-year-old father, but we're all taking these precautions, so I'm not sure what that was about. And, we're seeing it in the comments. I mean, people want you guys to... So stop fighting. But I mean, you can't just sit there and take stuff too.
Yeah, exactly. And for Tulane to start up, and if you hear every time someone tries to speak on something, she always interrupts. It's like she's having a temper tantrum, a spoiled tantrum. And she needs to stop. She needs to grow up, is what she needs to do.
I want to talk about the amendment
Right.
and the issues you had with it, because when I was watching, I thought the bill was about curfew, and then all of a sudden we're hearing these different amendments. So what in particular had you going about this amendment and why you were calling it a bargaining chip?
Yeah, absolutely. I had the same premonition when the amendment first came out. Are we on the same bill? This was totally different, out of left field. And I was wondering why it took so long for the break to come, because she had an amendment going that, okay, this is what's happening. She wants to either, one, try and find a way for people to vote for this bill, this curfew bill, or two, put a bargaining chip in the bill to make it look another reason for us to all vote for this bill. But it all boils down to, okay, we will give the governor the authority to have curfew and shelter in place, which was ridiculous, if she gives us all this information. It's a total bargaining chip. I mean, we do that with our own kids, right? Okay, clean, do the dishes and everything, and then I'll let you go take the car out or what.
Yeah, a little bit of a different situation. This one's like, do this, do that, do this, and we'll let you put on a curfew. Those
Right,
pesky human beings.
Exactly. So it's a total bargaining chip, for the governor, and finding a way for all the other senators to vote for this bill. There's quite a bit of senators who already stated they're not supporting this bill.
Right. So what's the score on that? I mean, it seemed like they were just Senator Shelton's support dropping off like flies yesterday.
Yeah.
I don't know what happened more, the recesses or senators dropping their support.
Yeah, that's true. That's true. Well, I can't speak for everybody, but I know that none of the Republican, well, at least the 4 Republican senators are not voting for this bill for sure. And I can tell you that but I don't know on the, of course, Tito Chalahi is not voting for it, as well as Joe San Agustin taking their name off. So people are following suit, and I'm just hoping today, after all these comments are coming in, that they will take this bill and put it back to the Committee of the Rules and leave it there. And like I said yesterday, if this was so important for the governor to have, then why didn't she create a legislation or write a bill and send it down and call us into special session if it was so important for her?
I know. And I wanted to ask about when it was first, I think it was set aside Monday, I think, by Senator Amanda Shelton. She said that they were, waiting for legal clarification. Did that ever come? Was there any legal clarification on both these bills?
I didn't see anything. Nothing was brought to our attention from the Attorney General at all, or from the Governor's legal counsel.
Okay. And what about the legislature's? Nothing from the legislature's legal counsel?
No, nothing at all from them as well. What was surprising was the shelter in place order. That doesn't make it. Shelter in place is basically if there's a shooter in the area, everybody stop where you are and stay where you are. And that's shelter in place. There are three different categories of shelter in place. Well, not categories of shelter in place, but 3 different categories that some states are using. One of them is shelter in place, stay-at-home order, and the one that the governor has put, which is social isolation, which is actually the lowest of all. I'm surprised she didn't do stay-at-home order. But stay-at-home order and social isolation are pretty much more lenient. Allows people for essential workers to go out, to go to the grocery stores, things like that, But shelter in place is like, shooter in the area, everybody stop, stay where you're at, whether you're home or not, wherever you're sitting at. So it didn't make sense for why she put shelter in place in that amendment that she made for her bill. So other than that, I think that I'm hoping today that this bill is sent back to the Committee on Rules like Bill 334.
What is this going to do to the you guys' relationship, if any, with the governor moving forward? Because she went pretty hard yesterday at the press conference. She said, "Hey, on our social media, I guess they were snooping around everyone's social media, that they saw that people had violated her orders over the weekend, the Easter weekend, and she said that we're going to start seeing the effects of this in a couple weeks." And again, she made her case that, she needs these extra powers because people are just not listening. And I think she said something about human beings or anyway. So what do you guys think this is going to do to your relationship with the governor? Is that even a factor? Because she took this to the legislature thinking that her innies, the Democratic leadership, were just going to ram it through. And that totally didn't happen. And I think the reason why it didn't is because everybody was watching. Everybody was watching, and the conversation was about ventilators. The conversation was about local assistance. And I think Speaker Barnes kind of waited in her head, like, if we go hard on what the governor wants and ram it through, a la FESPAC or whatever, the political repercussions are just going to be too damaging. I don't know.
Chris, I don't even know what kind of relationship we have. The last time we heard from her was over 3 weeks ago, about 2 or 3 weeks ago. We haven't heard from her since. She hasn't called us into a meeting. And then when she provided Ricky Hernandez, David Delasolo, along with Director Shimzu, to a Zoom conference that lasted, a half an hour or a little over a half an hour, we couldn't even answer questions, and that was the extent of it. So I don't know what kind of relationship we had in the first place, at least for the four of us. We're not invited to the table. And during a crisis like this, everybody should come together. I mean, that's what she keeps touting. And even the speaker keeps touting. We should all come together. And we're in a crisis right now. They're not including everybody. They're excluding people from this. So I don't know if it's going to make a difference to whatever relationship we do have. But I do know one thing, that the government needs to give us some information for us, information that we are asking for, and not hiding it or keeping it to herself for some reason. It doesn't make any sense. Mm-hmm. So this is, I guess, I don't know what else to say. We are kind of frustrated in the legislature right now, but I think that we just need to, like I said, work together. But unfortunately, I'm not going to stop trying. I'm definitely not going to stop trying. So, and I will look at everything, cross my T's and dot my I's, and I will call out people who I feel is more damaging than help.
Mm-hmm.
But anyways.
Do you know where we can get copies of the amendments to the bill? Because I'm trying to find them online, and I'm not sure where. I'm on the... they're not... I don't think they're online. What we're doing is we're using Google's Doc to share amongst the senators that are emailed to the senators. But that's a good point. These amendments should be downloaded on the website to allow some transparency. And I will bring that up. I'll bring that up to the clerk when I get in the morning to find a way that the media and the community can also follow along with these amendments as they come out. But then again, during regular session, these amendments are not visibly out online or anything like that during or at least the ones that are adopted. It would be nice to be able to follow along, but.
Yeah, please. Well, please see. I'll be happy to have my staff, send you any kind of amendments that you need at all. Just give me a WhatsApp, a text, and I'll be happy to send it to you even in real time too, as we go along.
Connect.
Oh yeah.
All right.
Absolutely.
Thank you.
Can you spray it down with Lysol before you send it?
Hey, he's out of order, isn't he?
I'm out of order. Point of personal privilege.
Point of personal. No, I'll be happy to do that safely by doing it online.
Yeah.
All right.
Which should have been online, so we won't have to go through this. I think that would be less stress if we were all online doing it on Zoom. But again, we're not running the show. We got someone in there who. Well, anyways.
I'll please, Minority Leader. You said so much. I don't know why you're holding back now.
Well,
All right. Well, good
Yeah,
luck
save
today.
it for 9 o'clock.
hey, but I wanna-
Emergency session.
You know what? That's right. I'll save it for another time. As we move on, I think I said enough actually this time around. And
But how
yeah,
does it go,
I'll save
Minor?
it.
No,
Senator-
you're saying how you feel.
Yeah,
like
Senator-
you said, you're fighting for the people.
Let me ask you. So after that, then you guys go at each other. What's it like afterwards? When you're walking out. I mean, are you guys atom bombing each other, or is it just part of the? I'm just curious.
Well, of course, a bigger person would just, brush it off the shoulder, walk out, say goodbye, everyone, and leave. But unfortunately, there's a whole lot of those in the legislature. So yeah, they do. They tend to, atom bomb at you as you walk out. And
wow.
So unfortunately, but then again, like I said, especially, and I will. Okay, now I'm going to say it. Especially those who have no respect for anybody else and start having temper tantrums on the floor just because people don't like what they're putting out there. Yeah, those especially are very childish and continue to be.
Can we get some names?
Nelson.
Oh, okay, I got you.
Should I have to say it? If anybody was watching yesterday, then you'll see it yourself,
And a lot of people are watching. I keep track of how many people watch the legislature's live feed and non-COVID times. And I think some of you guys see this and you're like, oh, I'm going to do some funny business because no one's watching. The viewership's way down, but now, like I said, everyone's staying home. We got nothing else to focus on but you guys. So.
Yeah. And I appreciate all those individuals who have been sending us emails and letters and texts, and it helps. Considering we can't have public hearing or anybody to voice on this legislation, and it becomes very difficult for us to even make decisions without the public input. So I really greatly appreciate people taking the time to email it, myself at least. And let me know how they feel about it. And
well, I know that you actually mentioned it on session floor. There was a letter that you had received regarding this new custom and quarantine policy.
Actually, there was one comment I made about a constituent calling about a custom, and the other one was talking about the Bill 335 and 334. And that was just a letter that really touched my heart. That I read a portion of that letter on the air. I mean, it said it all, from the exhaustion of our own public safety officers out there, and that everyone is doing their part and staying at home. The roadblocks are working, and it was just a well-written letter, and I felt compelled to do it. In fact, again, it really surprised me because after I did do that, probably a couple hours later, I received an email from the same person thanking me for reading it, that now she has more confidence in the government, that her voice is really being heard out there. So it was very heartwarming to hear that.
Okay, Minority Leader. Thank you so much for your time, Senator Tello, and good luck today.
Okay, everybody, create a great day.
All right, we'll see you at 9.
Okay.
Okay,
All right.
see you then. Thank
All right.
you. Bye-bye.
Okay, bye.
7 o'clock, we're KUAM FM in Hagåtña, Guam. That was Minority Leader Senator Tello Taitagui. And so curious about the status of, these bills. I mean, we know the status, but reached out to Senator Amanda Shelton, and she's going to be calling into the show in just a couple minutes. And also, Department of Public Health Social Services Director Linda Ampinko Denorsi is scheduled on the show. We're going to take just a real quick break. It's Containing COVID. Guam's favorite, the KUAM News takeover of I-94. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Oh yeah. You know, I mentioned FESPAC a little bit ago, so I had to take it back to FESPAC. This is the Fiji delegation. Sweet darling. Cool, huh? Yeah, FESPAC, it was a thing back then. Really? Yeah, this is when I was in radio, and we had a whole like live thing at the FESPAC. Remember we had a hunt and all that?
Oh yeah.
It was like a million years ago.
You were in radio.
Yeah, way back then.
Oh.
Yeah.
Can't remember.
Used to do a radio thing. I don't know if you heard it. Yeah. Google it. It's not on Guampedia, but you can Google it.
Hey, you did radio?
Yeah, 704. Good morning. Let's get Senator Amanda Shelton, and this is her baby, this curfew bill. Good morning, Senator.
Good morning, Chris. Good morning, Sabrina. How are you guys?
Hanging in there.
Yeah, we are.
How are you?
How are you doing, Senator? How are you
I'm
doing?
well. Hanging in there as well.
So kind of a rough day. I mean, outside looking in yesterday for you is this bill, this curfew bill, which I know that you really believe that the governor needs this authority. Can you just kind of like, and you did it in session I saw yesterday, but maybe state your case a little bit for the audience?
Sure. Thanks, Chris. A couple of weeks ago, I wrote a letter along with the Vice Speaker to the governor asking her to implement some further interventions to help us stop the spread of the virus. And she came back a couple of days later saying that she consulted with the Attorney General and that she needed some additional powers to allow her to do that. And so, very quickly I drafted this bill to give her those specific powers to implement these measures. And so yesterday on the floor, there was a lot of discussion about it. And I know, that many of our colleagues and I as well have been receiving emails from individuals and concerned constituents. So about individual rights and about how, they don't wish to give the governor any more power to do these things. But, my position from the very start of all of this has been that, I really want to do anything we possibly can to protect the people. I want to make sure that, we're doing every single thing within our power and whatever is possible for us to do. And so I thought that this bill was still necessary at this time to allow her to set this curfew.
Mm-hmm. And so we are hearing about this curfew. That's what we're hearing a lot about. But what about some of the amendments that have been passed and added into this bill? Can you tell us a little bit about that? Because I can't seem to find any amendments that have been passed on the legislature's website.
Sure. I can have a copy sent to you of the substitute version that I introduced on the floor yesterday. So I drafted a substitute version in consultation, of course, with our legal counsel in the legislature to really understand what the powers of the governor are that already exist under the emergency powers of the governor. And so that's why we introduced that substitute version that again includes the curfew part as well as a shelter-in-place provision for the governor. And lots of colleagues came to me in the time that we introduced it until we got to it on session floor, who expressed that they thought that it just wasn't detailed enough, restraining the governor's powers, that it was just a very broad brushstroke that we did in the first version of the bill. And that's why I made it specific to only this COVID emergency. And then I put in a provision that the curfew could last no more than 15 days. And so everything was very specific to just responding to the COVID emergency. It wouldn't last any longer than that or be, excessive, more excessive than it needed to be.
Point of personal privilege, Senator. So you kind of you're right. The people made those points, and then you went back and kind of whittled away and fine tuned it. That being said, we did see some of the support, drop off yesterday. Where are you this morning? And is there any effort on your part, caucus, maybe to kind of try and re-impress upon some of your colleagues who dropped off of this to maybe come back on and?
Well, I respect, everyone's opinion and what they stated on the floor yesterday. I will continue to push the bill. There are still some of our colleagues who have not spoken on it yet. And, of course, there are some who have already expressed that they're not going to support it. But I'm going to still push forward today and just, again, what you said, impress upon the body that this is something that I still believe in. I still believe that we need to do everything that we can to protect our people, because in a couple weeks from now, as the Governor's Physician Advisory Council stated, we haven't hit our peak. It might be coming in May and it might be coming in June, and we're praying very hard that it won't come, that those numbers won't actually come. But if they do in a couple months from now, then I want to be on the right side of history. I want to know that I did everything that I could have done to protect the people and to save as many lives as possible.
You mentioned earlier that you'd heard from your constituents, you've received emails, phone calls. What was their main concern about the bill?
I think they're very concerned about giving the governor any additional power or allowing her to implement more interventions that they see as infringing on their rights to move and to do whatever they please during this time. But I have to say that I have received many, many messages from others who have expressed that they would like to see anything at all that needs to be done to encourage people to stay where they are, to stay home, and to take all of these measures seriously. So I've heard from different nurses who are working at the hospital, who are seeing this firsthand, who are really affected by it and just want us to do whatever we can. And I've heard from doctors as well, and just concerned families in the community, and lots of Manamku who are calling me up and who are sending messages through my family saying that, that we just need to do everything we can, and they are supportive of this. So I'm very aware of both sides of the issue, and I respect both sides of the issue. And for me, this is really what I believe, that I need to do everything that I can do to help protect the people.
Mm-hmm. There was some discussion on the floor, and I think a little bit of it may have been included in the Vice Speaker's amendment about the need for more transparency from the administration. What are your thoughts on that? Do you feel that the public is being adequately informed about what's happening with COVID?
I have to say I really do appreciate the governor's daily press conferences, her daily briefings, and a lot of times her staff is very good about communicating with us at the different legislators on issues that we're asking about, and sometimes we could use a little more information. And so I know my colleagues on the floor wanted to hear very specific plans from the governor about what she wanted to do with these extra powers we would be giving her during this time. But there's no specific plan. She has said in the press conferences that she needs this additional power, of course, a very limited and temporary power, so that she can implement these measures. But we're all craving for more information and just to help us move along to see what we can do, because I know for me and my colleagues, we want to help in any way we possibly can. And so having information, having data, understanding the plans that are ahead of us will help drive our efforts as well.
I wonder how hard would it be if, maybe the governor deputized the chief of staff or, any one of the cabinet people to open that line of communication, because I think if she's continuing to go hard on this request, then if there's questions from the senators, then maybe someone should be made available to, you know what I mean? So that instead of you being the middleman or middlewoman, they can just get it straight and ask. I mean, is that even a possibility, or is the governor too busy?
Oh, no, I'm sure the governor is very busy, but we do have some communication right now with her staff, and so I appreciate their efforts, and I understand that they're also very busy.
Well, I guess we want to wish you luck. I know you got a big day ahead of you. Are there any consolation plans if this thing dies today? What's the way forward for you?
Today I am still focused on this bill and wanting to move it forward again to protect our people, to stop the spread of COVID. But, I am looking ahead as well, because I know that at the end of the day, this is going to be a big hit to our government, our whole economy, and just the loss of revenues that we're going to experience is going to be a big deal. And we know that all of this federal stimulus money that's going to be infused into Guam is not going to help us recover from a loss of revenue. It's very specific how we can use the money. And so I'm looking at how we can move forward and open back up the economy, and how we can help our people get back to work. And I think I'm grateful right now that we have these military members who are buying out the hotels and starting to infuse some money that way. And so I hope that we're collecting on our hotel occupancy taxes, and that's going to be some kind of infusion for us. And really, otherwise they would be totally empty. And so I think that we've been very generous in that way to allow our military brothers and sisters to come in and to use the hotels in this way. And I just want to make sure that that's a win-win for us. That's a win for Guam as well, and that we move forward and we find other means of economic activity that can help us.
What about, I know there's all this talk about giving the governor power and not to give her power, but what about helping people that are waiting in line, hungry, the bottleneck that's happening at the Department of Public Health? They have 20 caseworkers. In 2 weeks, they saw 400 new applications. And one of the problems is that, people can't go out and get this long list of required documents that they need just to be approved. Is anybody in the legislature working on that? I mean,
I think you guys could use your powers to, maybe kind of corral some of these agencies, write some letters, or, spur some type of action. Because, Senator, I'm sure you understand that part of the narrative is that, we're doing all this stuff to give the governor extra powers, but, no one's trying to give the people any extra powers or anything extra.
Well, Chris, we had two measures that were on the bill. That was the RISE Act to get some money straight into the pockets of our people right now, especially those who have lost their job or lost hours in recent weeks. And then we had the unemployment insurance program that was also on the agenda, and we weren't able to move forward with those because of some other things that were happening. But those were measures we were really looking forward to, because the same people who are now signing up for SNAP would have benefited from this unemployment insurance program that we were trying to implement, and would have definitely benefited from our bill with Senator Regine Lee that would have put the money directly into their pockets. So I know that those are not completely off the agenda. They've been set aside if they're needed down the line. But you're absolutely right. Anything that we can do on our end to speed up the process for everyone trying to look for assistance now is, I will look into that.
Yeah, maybe provide some staffers or, something, I don't know.
Well, thanks, Senator Shelton, and good luck today at 9 a.m.
Yeah, thank you, guys. I'm sure you'll be watching.
I'm pretty sure we will. Point of personal privilege, you got to, we will.
He's using that too much.
Sorry, okay, I'm out of order.
Substitute version over to you guys so you can see what we're working with on
All right.
the floor.
Thank you, Senator.
Okay, thank
you.
you.
Be safe.
Okay, Joss. 7:17. Hey, I got to do news, and going to get Linda from Public Health on the line. It's containing COVID, Guam's favorite, I-94. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information. GU Self Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
It's a dilemma, or it's a bargaining tool to let her have curfew, to give her the authority to implement curfew. So,
point of personal privilege, Madam Speaker.
Please state your point of personal privilege, Vice Speaker.
The amendment are conditions if she wants to institute curfew. There's no bargain here.
Thank you, Vice Speaker. Minority Leader.
Thank you, Madam Speaker.
Please proceed.
Health on the line. Good morning, Linda. Thank you so much for your call.
Hi, Linda.
I guess just first of all, I know we had asked yesterday, everybody's talking about Saipan, CNMI, getting all these test kits. Where are we on that, Linda? And are we looped into, are we going to see, getting, 20,000 test kits or something?
Yeah, that's a good question. But first of all, I'd like to say that I spoke with Ms. Muña, Esther Muña, the CEO of CNMI Corporation, and these test kits that she received is not FDA approved. They're still applying for the emergency utilization authorization, so it has not been approved yet, and she did confirm that with me. And so, even with that, I have a listing of all the emergency utilization authorization instruments and test kits that were sent to me through FEMA. And right now, as we speak, I'm only authorizing tests to be done on all those test kits and test machines that are FDA approved, and they're certified to be approved. We want to make sure that the safety is ensured for those who are tested. And after speaking with her, she also told me that they're not going to be using these test kits for diagnostic purposes. They're going to just be using it for surveillance. Now, in regards to that, yes, we are moving forward with having more test kits, and 2 more Abbott ID new test kits have arrived, and this is also approved by FEMA, and we got it from FEMA. So we received it, and the day before yesterday, we gave one to GMH, and we kept the other one in our laboratory. Now, this is a rapid test kit, and this testing can be done where a positive result can be read within 5 minutes, and if you are testing negative, it'll take about 13 to 15 minutes. And so yesterday, we actually trained also the hospital staff, their laboratory staff, and we got them to calibrate and validate the machine, and also utilizing the test kit that we have. And so I'm happy to report that everyone has been trained, and they used it for the second batch yesterday in yesterday's test. So we're running 2 tests. Yesterday we ran 2 machines, the AVI 7500 and the Abbott ID Now, and we're assured by the federal government through CDC that we're going to continue to get more and more tests for the Abbott ID Now. And not only Guam, but the U.S. API should be receiving it as well. After speaking with Ms. Muña, she indicated that she hasn't received her Abbott ID Now. So the thing about it is, I want to ensure the safety, as I mentioned earlier. And even if Saipan were to use this kit, it's not yet approved. They're still applying, as I mentioned, for the emergency utilization authorization. And my concern is that if we were to use it in Guam, it may test negative. And a false negative is not going to be very good, because that person could be truly, false negative means they may be positive. And so I'm very reluctant at this point until I know it's either approved by FDA or there's an emergency utilization authorization that has been granted. Then, of course, we will look into that as well. So I hope that answers your question. In addition to that, the Gene Expert machine is also being purchased by Guam Regional Medical City, and we also have a Gene Expert machine in our laboratory. And we're just waiting right now, as I mentioned earlier, for the arrival of 4,600 test kits. That's through a grant that was funded through the Pacific Island Health Officers Association. And on top of that, we are also looking into getting that machine up and running along with GRMC. And we have been sending actually a lot of the low priority, as I've spoken to you and Sabrina earlier when I'm being interviewed. We started that with the diagnostic laboratory, and as I mentioned, it goes to Hawaii and also to Quest, California. So even those with asymptomatic swabs, those patients that have swabs, nasopharyngeal swabs that are asymptomatic, we're still testing them, but we're testing those off island, and that's again through DLS, through Hawaii, or through Quest, which is a commercial lab. We started that on April 3rd. Through the 13th, we have already sent out 101 specimen samples, and of that, 5 have tested to be positive and 96 are negative. So I just wanted to throw that in. And we've been also assisting the other USAPI in their testing. So they're getting that support from us, and that's the reason why we've been granted one of the first in the Pacific to actually have the testing capacity through our ABI 7500 machine. And so with the USAPI altogether, we've done 58 tests for them. So we're moving forward, and of course with the support, we've been getting lots of support from CDC, and we follow their guidelines. And so I just wanted to assure you that we're going to continue to get the support from them and also through FEMA.
Well, Linda, thank you for bringing that up, because that was a lot of the messaging I was getting last night, that these tests aren't FDA approved. But then also, concurrently, people were saying that, yeah, they're not FDA approved, but that there are big deliveries of these tests going to the federal government. Is that accurate? What can you say about that?
Yeah, you know what? It's not yet approved for emergency utilization authorization. Okay. So if that's not approved, nothing is going to go through if you don't have the FDA or the emergency utilization authorization, or what we call EUA.
Right.
So, until that happens, nothing's going to happen until we get that approval.
Okay.
And the safety is our key here. And you know that. And after speaking to Esther, she indicated to me that they're not even using those 20,000 for diagnostic purposes. So what does that tell you? That tells you that diagnosis is not going to be considered with those test kits.
What does that mean in English, Linda, for our lay people?
Is that if a person were to be clinically diagnosed or in the hospital and they're taking a test, the test is the only way to identify if they're truly positive or negative, is one way through this, having a very valid test, which is through, in our case, the ABI 7500, and now with the Abbott ID. That's the only way we can determine if they're indeed positive or negative. Or a clinical diagnosis. What that means is if the test does come out to be negative, but there are signs in the x-ray that they have a glassy look that is COVID positive, the physician can diagnose the patient as having COVID positive due to the clinical diagnosis and the assessment through radiology. Yeah.
The 2 new machines you were talking about during the press conference yesterday, you made these are more of like a rapid type testing, right? So are these through a swab, or are they a serological?
No, it's not serological. It's a nasopharyngeal swab.
Okay.
It's the same way you do the ABI 7500.
Okay.
It's a test that you just take a swab through the pharynx real deep, and then you take the sample in there, and then we run the sample through the machine, and so that's how it's done. So it's done pretty much the same way. It's not a serology. It's not serum where you prick your finger and you run the test. Yeah.
But they can be run within 13 to 15 minutes, right?
If you test this, it's 13 to 15 minutes. If you test positive, it can give you a result within 5 minutes. So imagine the speed of that, right?
Wow.
Compared to the ABI 7500. Our ABI 7500 runs for 6 hours for 20 tests. And that's why you see a first batch coming in towards the late afternoon, and the last batch coming out by, let's say, 9 o'clock, 9:30. Yeah, and so this is a PCR, which is a polymerase chain reaction type of testing. It's similar to the Gene Expert. It's also a PCR machine, and that's another machine we're waiting for more tests to come in. But I'm assured by FEMA and also my lab, and they have close contacts with CDC and the IRA. and they are getting a lot of their test kits coming in through the Abbott ID Now, the rapid testing. So we're going to increase our speed in that very shortly.
For the 4,000 test kits that we're still waiting to arrive for the Gene Expert, you also mentioned that GRMC was getting a Gene Expert machine. We already have our own. So for those 4,000 test kits, are we going to split them in half, 2,000 going to GRMC, or that whole entire 4,000 is going to public health?
That whole 4,600 will be for public health. I believe the hospital has ordered their own supplies and their own machine.
Okay.
Linda, so I just want to ask about the test that we're doing, because hasn't there been instances where people have tested negative and then later tested positive? Is that because of the test kits, or is it more to do with the way the virus is?
No, it has also a lot to do with the way the sample is being taken. Sometimes the nasopharyngeal swab is not done right or well, and so sometimes we have to do what is called, it's inconclusive. The result may not show whether it's positive or negative. That's one incident. The other incident, if it's negative and it reverts to positive, the person could be asymptomatic. Maybe there are not enough viral loads yet. There's not enough virus samples in the individual or the sample that was taken, and then maybe when they redid it, they deeper into the pharynx and they can get more of a viral load and a better type of test sample.
Right.
So that could happen. Or they revert, sometimes they are in community contact or a household contact that they may have been exposed to somebody that could be asymptomatic and have gotten the infection. So then they obviously later on during the incubation period, which is 2 to 14 days, they can acquire the infection.
Linda, I wanted to ask you said something during the press conference yesterday. One of the media had asked about why there's this unwillingness to identify the two, one public health clinic and the private health clinic where I guess people caught COVID. And maybe you can respond to that after you answer, but my question was, you had said something, I believe, about you were testing all the healthcare workers at these two clinics. Is that correct?
Yes. Everybody has been all tested.
Okay,
yes.
So does that have anything to do with the last few days of the zero positives? Because I'm just trying to work it all out in my head here.
In regards to all of them, they've been tested actually since that time that we released the information. They've been undergoing lots of testing. In fact, this has been after the March 25th. This was the second batch that we indicated. So we did a lot of the surveillance and contract tracing to identify who these workers were exposed to and what household contacts or community contacts. So everybody has been examined already, and so we pretty much have it under control as far as all the contacts that have been made. And again, you never know. I always emphasize that we can do all the tracing that we want, but sometimes when we ask people questions and they don't answer it correctly or they're not truthful, then we just have to get their responses in good faith. And so when we do the investigation, that's part of what we're asking them. Have you traveled? Who are you in close contact with? Have you been in any settings with other people, clusters and so forth, and group settings and group functions? And that's how, we're trying to identify them. And we've gotten a lot of responses from individuals also that have been positive, and there's still a stigmatism attached to those that feel that they are positive. And we just want to, I'm bounded also by HIPAA, and I can't release any names. And I just want to protect the integrity of the business as well. And also knowing that everybody knows who they are and that they've been identified. I'm pretty
Linda,
much,
but just to play devil's advocate here, or just advocate, you guys named Hofade Bingo, which is a private entity. You named the Iglesia de Cristo, which again is a community civic organization. So for a lot of people, it just doesn't fly that we can tell people and talk about where other clusters have come from, but not
United Airlines.
Right. Yeah. So can you kind of just, because the logic doesn't match up in a lot of people's minds.
Yeah, I know. It doesn't match up, but again, I just wanted to emphasize the stigmatism attached, and so we just want to, just keep it at that at this point in time.
You also said, though, that one was public and one was private. So what public clinic are we talking about?
Well, there would be the public health clinics and then GMH, right? Are those the only public clinics, Linda?
Those are the only public clinics we have.
Right. So it's got to be one of those.
So can you say if it's north, central, south?
I would, Sabrina, I just want to just move on and keep that as the way we are reporting. Okay.
Okay, let's just move on. What about? I wanted to talk a little bit about public assistance because we did talk with Tess Archangel, and she really gave a wealth of information. And with the 400, especially within the past 2 weeks that have rushed to apply, but they're having an issue with providing the necessary and required documents. And I know that during one of the press conferences, you were mentioning how you're trying to reach out to the mayors and work with them. Where are we?
I spoke to the president, Mayor Savaras, already, and she already assured me that all the mayors are informed and they're notified that when we have names of people that need to be verified, that we just send them the email of the listing and then they will respond to give us the verification. So she has assured me that has been in place. And so right now, we're also waiting for more information to be gathered in regards to the application process of those that have been furloughed and those that have had reduced hours or those that have been laid off. So we're just getting that information, and we're just waiting for that information to come in through the Department of Labor. For the names of employees, we're just pending the names of employees, which is required for our BES, the SNAP, to process their applications.
Okay. Is the funding for this program, is it local money or is it federal money? Is it a reimbursement?
For the SNAP right now, the SNAP, which program are you talking about, the Medicaid or the SNAP?
SNAP.
Okay, for the SNAP, it is federal, absolutely federal. This is what we call the emergency allotment funds, so that anyone that is already a SNAP recipient, they're going to get the maximum amount. And that's what they're working with DMR to get also the listing of all those individuals, because DMR is our vendor with our PH Pro. And so they're having to calculate what would be the maximum benefit, and so that's also what we're waiting for. So we should get that done hopefully by at the latest next week. I'm assuming it would take only 1 week. That's what I was told by Tess.
Linda, I got to ask you about this. There's something going around with the GITA director, and I don't want to get into the specifics of it because I'm pretty sure there's some type of HIPAA thing, but are we still allowing people with significant ties to the community to skip out on the mandatory quarantine?
I think the quarantine is different from, I have to explain what quarantine versus isolation. The quarantine
so Linda, I'm sorry
we know the difference.
Yeah, I'm sorry to interrupt,
okay.
but can you just speak specifically to that instance where people are saying that the director of GITA was allowed to, skip out on the mandatory? Because I was under the impression that all flights coming into Guam were subject to quarantine in the hotels.
I cannot say about the HIPAA requirements, but in this case, when we identify anyone who is in quarantine, this particular situation, we have. I would just say that when we isolate individuals, there are different ways of isolating people that have become, either negative, reverting to another test being positive, and the isolation could be either in the home. That's if they exhibit mild symptoms or they exhibit symptoms that are asymptomatic, which means they have no symptoms at all. And then there's another way that we also do it is through the actual government of Guam facility, where they can stay, or they're either hospitalized or they are at the SNF. And so because of HIPAA compliancy, I just want to share that information.
Right.
And, I don't want to release any information about any individual because, I'm bounded by HIPAA.
Yeah.
But just to notify you, I have been at court and, that I did explain to the judge that when there are times when people are also in quarantine, when they have other issues for example, they have comorbid issues, chronic diseases, or they have lung COPD, anything of that nature, or they have behavioral health issues, that we've moved them out of quarantine in our Government of Guam facility, and we've moved them into home quarantine. So I hope that explains enough for you to put it together.
Yeah.
Okay?
Okay.
Yeah.
Okay.
Yeah, and so we've done that. I was very honest with the court, as I have to.
I'm good at putting stuff together, Linda, and I could see what you're saying without you saying what you're saying.
Yes, thank you very much. I appreciate that, and in all integrity for the purpose of not releasing any health information. Thank you.
I guess last question that just came in on the Facebook comments. The decision to not disclose which two clinics gave patients COVID, was that public health's call, or was that something that the governor decided?
I'm sorry, can you repeat that question again?
The decision to not disclose which two clinics gave the patients COVID, was that public health's decision or the governor's decision?
It was my decision, and I take that because of the fact, my decision along with my team, we discussed that very thoroughly. And, you know, the clinics are the forefront. They're the ones that are helping the patients. And we wanted to maintain, there have been, as you already know, as I've been mentioning, there are healthcare workers that have been positive. And that's also in line with what has been happening through household transmission, community transmission, and close contacts. And so we want to maintain the integrity of our whole system, especially the healthcare system, which is very, very critical to the operations of this COVID response.
And just real quickly, where are we with the other cluster investigations then? We have the Iglesia Ni Cristo.
Yeah, I'm glad you mentioned about the Iglesia Ni Cristo Church. Yes, when I reported we had 11, remember when that press came out through JIC, now we're at 17 positive from that cluster. All the other clusters remain okay. We found out also that the Mingilao was cleared in terms of there was no exposure on that side of the Mingilao after we have done our investigation. But the other three churches, the three sites of the Iglesia Ni Cristo, we've examined 320 individuals. I just wanted to share that.
Have any of this been linked to what happened in Saipan?
Yes, actually, there were two cases that came from the Iglesia Church, the Iglesia Ni Cristo, that were positive for Saipan. Yes.
Okay. But you guys aren't communicating where they are with their trace investigation. I'm just wondering, did it come from Guam and they went over there? And
Yeah, they flew to Saipan, but we give them the results because, as you know, we do test for Saipan and the US API. And yes, we've given them the results, so they're very much aware. And I communicate a lot with Esther Muña. We're very good friends, and we're very much involved with the Pacific Island Health Officers Association. And so we provide a lot of information with each other, and we help each other, if we have any needs. And she has also shared that any supplies or equipment she needs, we can share it together, as we have been doing.
All right. Well, thank you so much, Linda,
Linda,
for your time.
I know you. That was a long 10 minutes. I really appreciate it.
You always do that to me, Chris.
I'm sorry, but I mean well. I'm just trying to get the info out.
I know, and I mean well too.
I know you do.
The factual information.
Yeah, amen, Linda. Amen. Thank you. That's what I love about you. You're like one of those boxers. You're going to stand in the pocket and you're going to take the shots and you're going to...
No, you know what? I've been boxed so much that they always hit me. I always fall to the ground, but I always come back up with all my staff. Everybody always critical, but I mentioned this to move forward. And even though we're criticized heavily, we do the best we can, and we are doing God's work. That's what's most important.
All right, Linda. Thank you so much. God bless you, okay?
You and your staff.
Yeah, wash your hands.
Thank you. Bye-bye.
Okay, bye. There you go. Linda and Pinko DeNorsi. Yeah, she's always willing to answer the questions, but, the thing is you got to get her.
Yeah, when she's right at that time.
Outside of the press conference.
Yeah.
Okay.
Thanks again.
7:44. We got to take a break. Coming up, hey, we got a commitment from the chief of the Guam Police Department to call in 8:30 this morning. That's, of course, Chief Stephen Ignacio. Also, we're going to hear from former Senator Dennis Rodriguez.
Yeah, he's on this. The speaker, she has this for medical advice. Oh, COVID-19 advisory group, and so we
Right.
got that letter last night, and his name was on there.
I
So
know.
it's like we need to talk to him and see what's going on. He's with the Toru Foundation, and he presented a plan for rapid testing in the community with his organization, and so.
And I'm curious about that plan because Linda was very firm on these test kits that they got in the CNMI, and she was basically like, no, that's like the Western Family brand. We're going to go with the real one, and, you know, we've got the machinery, and so they seem
There's
pretty...
nothing wrong with Western
No, I'm
Family.
just saying, you know, I'm making a metaphor, but I know, I'm a Western family, don't worry.
Springfield.
Springfield. Yeah,
All
so,
right, okay,
yeah, so
so-
I'm curious if that's just not an option or what, because you know, Speaker Tina has the committee, but then again, you know, these senators, if they kill the governor's bills, I don't really see the governor having the willingness to, you know, entertain any. It's petty like that. It's unfortunate, but you know. 7:45, so we'll be back. It's Containing COVID, Guam's favorite.
We are open to serve you at Cars Plus Guam. Need a quick service for your vehicle? Visit our express lane at Cars Plus. Done
GU
fast.
Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hoffaday, I'm Jonah Goncharfris, senior producer for KUAM News, and I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home, to protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home, make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Specialist Joshua Mansonotia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Working hard to keep you safe. Wash your hands. Stay home.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
sana fadais tigi KUAM News Update gifinut samoro para Metcolis. Dia akin sige abrid 2020. Manusia ni Navy na matay di Marino gin USS Theodore Roosevelt. I Marino ni tema identifika stig manitifika i familianya. Sa matay gin Naval Hospital gilunis gin ni chanut COVID-19. Positibo ani mates gi dia akin tagi matso. Sa poli gi isolation na guma gi Navy base. Sa 4 otusiha na Marino ni manina di lokwi. Gimapos na webes na masoda itaw to na tikumalalam tim sa matsagi ma CPR. Ni otusiha na Marino za ni timi medico wi hinaguma. Pas makonni para Naval Hospital sa mapegay gi ICU. Sigoni mas nuevo na numero gini ni Navy. 565 man ninaji ni COVID-19. 3,921 man negatibo test niya. Sa 4,000 na Marino sa man makonni huzing gi Roosevelt na batko sa halom gi itano. Gi mas news ibisinuta gi Norte Mariana sa mamerjibi 20,000 na test kit siya gi pangin lunes. Sen nang kruwesti na rinspondo para inajuda ni CNMI po di COVID-19. Lenga gobierno ni CNMI si Ralph Torres na 20,000 na test kit sa manggagi sa ipan sa mas pipa-impenyo para magsigi man mates itaw-taw siya yan sigidas. Anunsya gi dyan na plegong Facebook si Torres di pangin lunes na naistabay gi plasan by Conairi. Lenga na esti na ninahi sa Sentinelaika yun na rinspondo para nasisti CNMI. Sa mafatsutsuy di ches semana na tempo tati para utay gwini humzom niya. Commonwealth Healthcare Corporation na CEO si Esther Munya kasangan ni KUM na matos tinakadya ginin South Korea sa rapid test kits STC ha. Ano mafaising ko residente gwihi siya man mates na di drive-thru na prosesa gitiam man na tempo linya si Munya na mafananan ST community-based testing para ma-identifika masanatan sa ma-contain. Linya naman matototso siya ni Senadette para manasiguro na tori tao-tao gwihi man mates. Adyo po siya mapuputso disti ani matos tinatsadnon. Sinya gait tempo sempri para offer mates to di manggaygi gwihi lo adzo mahanano gwihi. Maripopor ni to di media siya gitano na para manafanhano mas ki 600 na test kits ni South Korea para Estados Unidos ni requestan Presidente Trump. Adyo na report loki sa explica na FEMA sa mga kontrata na informatitan sa STC na test kits sa Asia para fan mates Amerikano siya. Yalinga si Munya na pareho adyo siya na test kits na man mato sa ipan na di para fanhano gato sa Amerika. Giginin ma-report Director Departamento ng Salud Publiko ginamangigi sa Guam si Linda Dinorsi asangani KUAM News na 5 na test siya manafansasangi para CNMI kada dia sa dumada niya esti na di manafanhano esta gato gwihi.
Cause I was raised by the water, so the mighty waves came over it, but now I'm falling victim to the current life, pushing me left and pulling me right. But where were you through the rocky seas? I said harbor's closed, won't give me the refuge, and even with the
Let's do it, Guam. Reminding you, you got the power. Yeah, we got the power to kill the curve containing COVID. We're doing a deep dive into the day's COVID-19 news after the 8 o'clock hour. And remember, we're jumping on TV 11 right at 8. So wanted to get our CNMI correspondent here reporting on the latest with COVID-19 in the Northern Marianas. Tini and Luta Saipan, Tomas Manglotnia. Good morning, Tomas.
Good morning, Brings.
Good morning.
So I know you got a lot. Let's get right to it. What's the latest from the NMI?
So we know that the task force in Commonwealth Health Center last night announced the additional 2 cases, bringing the CNMI's total confirmed cases to 13. Of the 2 cases, both are male. It's a 55-year-old male and a 61-year-old male. Both are in stable condition and are being closely monitored by CHCC medical teams. Also, as of April 14, to kind of give you a bird's eye view of the testing here in the CNMI submitted 59 specimens for COVID-19 testing. Of these 59 specimens, 55 have been processed, resulting in 13 positive, 42 negative. CHC awaits for the 4 remaining specimens. Also, the governor's office saying that the CNMI governor's office saying that they are expecting 40,000 more test kits later this week for a total of 60,000 test kits acquired for the CNMI, as we reported last night on primetime. They tell KUAM that this was a locally driven operation by the COVID-19 task force and CHCC, and they expect to be reimbursed by FEMA using local funds to make that purchase. Along with the test kits, a clinical pathologist from South Korea also arrived on island to perform equipment calibration and test quality assurance and quality control of the test kits, according to that press release. The governor's office and the task force and CHC are finalizing the CNMI testing implementation plan based on the Homeland Security strategy listed. And, as we also reported last night. They're going to work on something that they're calling community-based testing. We'll learn more about that later today after interviewing CHC CEO Esther Muña. Also, breaking this morning, the governor posting late last night that the COVID-19 task force is revamping the Kanoa Resort Hotel on Saipan as an alternative care site to treat confirmed and suspected COVID-19 patients during their isolation. In that announcement, the governor hoping that he'll never have to use that site, but saying that it's a part of the preventative measures. He says this is another proactive step to increase local medical capacity if confirmed cases increased in the CNMI. And Bree and Chris, as some of our viewers might know, we're going to be interviewing CEO Esther Muña later today to get more information on the 60,000 test kits we're expected to have by the end of the week. And also interviewing U.S. Congressman Kilili tomorrow at 10:15 right after this special report. So those are the updates for today.
Great job. That's a lot of information. And I'm actually looking forward to hearing from Esther and explaining these tests, because, we did speak with Linda DeNorsi from Public Health here, and she mentioned how she has been in communication with Esther, and she's a good friend of hers. But she did say about these test kits that they're not necessarily FDA approved. So...
Yes, and as I shared yesterday, early morning when we just got the breaking news, Esther says it's the equivalent in Korea. We also know that this is part of that same, or in addition to that same batch that the U.S. is planning to receive about 750,000 of them. But we're gonna get down to as Chris said it, English terms, and see how we can what exactly is this? What are we talking about? So we're hoping to get that very clear on tonight's newscast.
Okay, well, thanks a lot. And everybody make sure to catch Tomas's interview. It'll be streaming, I believe, on our Facebook page and posted on YouTube.
Right, and then tomorrow, Tomas, you're going to break bread with the CNMI delegate, Kilili Sablan, right?
That's correct, 10:15 a.m. right after the special report. So folks can plan to stick with us for about 5 hours if they want.
Right. Hey, 5 hours of KUAM sounds like a plan to me.
Yeah, it does. And you know what, Bree, I was just thinking about a few weeks ago when we had our first case, and you said get ready for things to ramp up. And man, are they ramping up? And folks having lots of different things coming out for them.
Yeah. Well, you stay safe, and thanks for all that you're doing. I know people really appreciate all the information you're providing.
All right. Thank you.
Okay. There you go, Tomas. It's been really hard to wash your hands. Talk to him over the NMI without asking for blueberry cream cheese bread.
I know. Oh gosh, maybe we should. Was Juan Carlos over there?
Juan Carlos is over here.
Oh, he's over here.
There's no flights over there unless you're taking the Glidey.
That's right.
Yeah.
Well, that ends April 30th, I believe.
Right. So it could be an extension, right? So it's been 1 month since the first COVID-19 positive cases. We were thinking about that this morning. Hard to believe that it's only been 1 month.
And we still have a couple more weeks to go under this.
Right.
Public health emergency, which again was extended until May 5th. But again, it's going to be a really good interview. Esther Muña, she's very thorough, she's very open, and we're really appreciative that she's very accessible. So that's happening today. And again, as Tomas mentioned, he will be interviewing Congressman Kilili Sablan. And I noticed on his Instagram page, he actually posted pictures of the status of the temporary hospital that's being set up outside of the CNMI hospital.
Right.
And it's really going up, and that's all from, I believe it's from FEMA, their 50-bed hospital, temporary hospital, or whatever it's called.
Yeah.
Right. And so I know that we've got the same sort of capability here. The equipment arrived, but it's not yet being deployed. So it's in storage.
Right. 7:59. We're about to jump over to KUAM TV 11, but we got a comment here, Bree. Do we have those public assistance numbers that maybe we could read out for people who are still trying to get a hold of some of that? The governor calls it local assistance. It's not locally funded. It's funded by the federal government, but I think what she's trying to say is that it's available locally.
Right.
Okay.
I'm just pulling up the number.
Okay, so we're going to get these numbers out for you guys. Again, the website, dphss.guam.gov. If you go on the website, and I think Ken St. Nicholas we're going to pump out a graphic here with all the stuff you need.
Yeah.
Okay.
So for Northern Guam, it is 635-7488, 635-7484, 635-7439, 7396, and 7429. As for Southern Guam, you can call 828-7542, 7534, or 828-7524. For Central Guam, 735-7340, 7519, 7256, and 735-7375. And those numbers are on your screen.
Good morning, Guam.
Off it, everybody. Thanks for joining us on KUAM TV 11,
Yes.
KUM-TV 11.
Yep, for those of you joining us, welcome to the show, KUAM FM, Agotnya, Guam. It is containing COVID again, where, we went back at, I think it was March 17. When did we do this?
Jason knows
I
the
lost
number,
track,
yeah.
So we decided that this was the best way because, we're all adhering to the governor's orders about, shutdowns and non-essential closures and social isolation. And so here at KUAM, everything we do is, with the safety of not just us, but the people out there. So we're not going out in the field. We're getting all the interviews over the phone. Obviously, we've got our PhDs in Zoom.
Yep.
By now. And this show
One of
is
those rapid PhDs.
Express PhD, right? So what we're trying to do here is give a platform for, government leaders, responders, the nonprofits to call in and get the info out to you guys and to help you weather this storm together, because we have the power to kill the curve of COVID-19.
And we also want to hear from you. Share your stories with us, how you're surviving this. All you have to do is give us a call at 637-0094. We want to hear from you.
There you go. And I got a birthday dedication. We're still doing the birthdays if you want. Patrick Avalon, that's coming from your sister, 802. Let's do it. The official start of Containing COVID, our 8 o'clock hour. Good morning, Guam.
Bendition, 'Con try peligro, namin. 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 'Con try peligro,
Hey, thank you guys for joining us. Really just trying to bring you this show as many ways as we can, utilizing the full force of the KUAM multimedia empire. So we are live on 93.9 FM, of course, streaming on the KUAM News app on KUAM.com. We're live on the KUAM News Facebook. Well, shout out to Rosa, coming from Brown Sugar Barnett. Also, there's a...
See Rosalind?
Yeah, there's a audio stream on Docomo, Channel 10, and obviously we're on KUAM TV 11 from 8 a.m. to 10 a.m., and we start the 8 o'clock hour with a deep dive into the day's COVID-19 news from the KUAM News team. Sabrina Solis-Manzanani. Good morning, Sabrina.
Half a day, everybody. The latest from the Joint Information Center released at 10:10 last night. The Department of Public Health and Social Services tested 30 individuals for COVID-19 on Tuesday. 0 tested positive through Public Health and 30 tested negative. 1 additional case was confirmed through DLS. To date, there are a total of 135 confirmed cases of COVID-19 on Guam, with 66 recoveries and 5 deaths. All 64 remaining cases are in isolation. Despite a week of low single-digit coronavirus infections, it's no time to celebrate, says the governor. In her daily press briefing, she and Physicians Task Force member Dr. Felix Cabrera cautioned that we must stay the course.
Thank you, Governor. Half a day, speaking on behalf of the Governor and State Surgeons Physician Advisory Group, we would like to give the general public a brief update as to what current COVID-19 positive cases are telling us in regards to our ongoing projections. On April 3rd, we presented projections that include a range of possible outcomes, including our plausible worst-case scenario. In this model, the projected peak may not be until the first week of June. FEMA's own independent modeling has a projected peak as early as mid-May. Therefore, any discussion on Guam already being past our peak is not only extremely premature,
we would like to
but
give the general
potentially
public
dangerous.
a brief update as to
This
what
is
current
especially concerning
COVID-19
as there is
cases
now
are
growing
telling us
consensus among
in regards
the
to our
country's
ongoing
experts
projections.
that COVID-19 has
On
the
April
potential
3rd,
to hit
we
us in
presented
waves
projections that include
if
a
we
range
relax our
of
preventative
possible
measures
outcomes,
too early
including
or too rapidly. Multiple waves, by definition, have multiple peaks. It would be irresponsible for us to believe that we are out of the woods or even close to it. It is very important to note that projections from epidemiological models are actually not meant to predict the future. Judging them as either right or wrong is a misuse of its purpose. Instead, they are a planning tool that describes a range of possible outcomes that are highly sensitive to our actions as a community. We must understand that these actions have significant lag time in what ultimately gets reported as new cases, hospitalizations, or deaths. If we act only on the best or most hopeful projected scenarios, we are likely to end up with the worst case scenarios. If we prepare for the plausible worst case scenarios and continue our resolve to strongly enact our early prevention efforts, we are much more likely to end up with a much better scenario. Lastly, it is important to realize that no country, state, or territory has yet to be over-prepared for COVID-19. If we stay the course and continue our mission, we can be more successful in decreasing the spread of coronavirus and thus saving lives.
Dr. Cabrera has projected that the cases won't peak until at least June, although he says FEMA's projections have it by mid-May. The bill to add sanctions to the governor's stay-at-home executive order was sent back to committee. Sponsor Speaker Tina Muñoz-Barnes passionately in defense of her measure, while opponents such as Senator Clint Rogel argued that it imposed further restrictions on our civil liberties.
I want to share with you, Madam Speaker, it is to give our island families the liberty to continue to go to the grocery store, the pharmacy, get dinner, but while reducing the risk of being exposed to COVID-19. And the only way to do this is to put measures in place to contain the spread of COVID-19. While I understand in my heart the many concerns, and I also comprehend that simply
that
putting this bill
simply
aside
putting this
would
bill
be the best
aside
thing to
would
do
be the best
politically?
thing to do politically?
I would hope that we put
I would hope that we put
our community
our community
and our island residents,
and
our
our
people
island
first.
residents,
So
our
I think
people
adding
first.
any more
So I think
restrictive
adding any
measures
more
to that
restrictive measures
is
to
also
that
difficult
is
for the
also
psyche of the
difficult for the
populace
psyche of
as
the
a whole.
populace as a
It
whole.
makes people feel even
It
more
makes people
constricted
feel
and
even
more
more
confined than
constricted
they
and more
currently
confined
are.
than they currently are.
And I think
And
people
I
need
think
to know that what
people
we're
need to
doing
know
is
that
working.
what we're doing
I
is
think they
working.
need to know
I
that
think
there
they need
is
to
a
know
light
that
at the end
there
of the
is a
tunnel.
light at the end of the
And I
tunnel.
think they need to see
And
a
I think
clear
they need to see
direction and a clear plan
direction
of
and
where
a
we
clear
go
plan
next
of
from
where
here.
we go next from
Not
here.
just let's lock
Not
it all
just
down.
let's lock it all
throw
down.
away the key.
Throw
and
away
then
the
we'll figure it
key,
out later.
And then we'll figure it out later.
The governor had urged senators to pass a bill giving more teeth to her roadblocks meant to discourage unnecessary travel. She's pledged to continue the measures despite the lack of sanctions.
Combating COVID-19 has required me to exercise my existing executive authority to keep Guam safe. This includes the implementation of public health road closures meant to deter non-essential movement throughout Guam and educate drivers on the risks associated with violating clear public health directives. This is done with the support from the Guam Army National Guard and GPD. We are not the only jurisdiction to implement this measure. Road closures are currently being deployed in North Carolina. The difference between us is violating an executive order during a public health emergency in North Carolina is a Class 2 misdemeanor, which carries a penalty of up to 60 days in jail and $1,000 fine. No such penalty or fine currently exists in Guam law, even though it exists in nearly every jurisdiction throughout the country. So I ask a simple question. If someone knowingly puts your family at risk for COVID-19 infection, could you live with the knowledge that what they did was not punishable by law? This morning, our legislature debated the merits of making a public health emergency declaration more enforceable. While I do not know what they will do, I respectfully ask them to keep that question in mind. No new laws would be necessary if we simply took responsibility for ourselves. I'm sad to admit that my social media accounts have seen numerous examples of those who violated our social isolation directives this weekend, potentially placing themselves and those around them in danger. The effects of these social gatherings may not be felt until 2 weeks from now. This is what we mean when we say COVID-19 is a slow and long illness. Your decisions today, your choice not to social distance may seem inconsequential, especially if you are only looking at the rate of new cases. But this mindset kills people. Human beings have the tendency to overestimate the positive. Hope is a powerful thing, and while we surrender it, our decisions must be based on science and what we learn from those who succeeded or failed. In recent days, I have been cautiously optimistic about our fight against COVID-19. But for many, that fight isn't just about the number of those infected or treated at our hospital. It's about the basic struggles.
A press briefing at 1 o'clock in the afternoon. Senators moved her bill 334 back to committee, but they began discussion at 2:30 on Bill 335, the legislation by Senator Amanda Shelton, also giving the governor more power during a state of public health emergency, allowing the governor to implement a curfew which would apply to all island residents. It also would allow her to mandate provisions to stop the spread of COVID. During the session, tensions reached a boiling point following discussion on an amendment that was proffered by Vice Speaker Talina Nelson.
It's a dilemma, or it's a bargaining tool to let her have curfew, to give her the authority to implement curfew. So,
point of personal privilege, Madam Speaker.
Please state your point of personal privilege, Vice Speaker.
The amendment are conditions if she wants to institute curfew. There's no bargain here.
Thank you, Vice Speaker. Minority Leader,
Thank you, Madam Speaker.
please proceed.
So once again, this is a bargaining tool to give you curfew.
Point of personal privilege, Madam
Oh
Speaker.
my gosh, I'm calling it the way I see
Go
it,
ahead.
and if she doesn't like it, I'm
Set-
really sorry about that. But it's
Minority Leader,
technically
please.
No.
a
There's
bargaining
been-
tool.
Minority Leader, please. You are out of order. Vice Speaker, please state your point of privilege.
The amendment is a requirement that the governor must give to the people of Guam if she is to institute a curfew. It is not a bargaining tool. These requirements is providing a sure plan that we don't know about. It is not a bargain. There's no scheming here.
Thank you, Vice Speaker. Minority Leader,
Thank you, Madam
have the floor.
Speaker. Again, if the governor doesn't act on these 4 measures here, then she can't have the curfew. So if that's not bargaining, I don't know what is.
Vice.
So moving
Minority
forward,
Leader.
no, I have the privilege, Madam Speaker, to speak my mind. And when I see something that looks this way, I have the option to say so. It's just an amendment that's going to be placed in here, and it ends up that the governor won't even sign it into law because of this amendment. Maybe that'll be good. But regardless, I don't want to hide by anything or just be deceivious from it, so I'm just going to object to this amendment, Madam Speaker.
Point of personal privilege, Madam Speaker.
State your point of personal privilege, Vice Speaker.
In according with our Mason rules, you don't attack the person or the characters or the individual's character. It was completely out of line,
Thank you.
unprofessional,
Point of personal
uncollegial.
privilege.
Thank you.
I still have the floor, Madam
Thank
Speaker.
Oh my God.
To call this a deception on the record, it's uncalled for. Every single one of us makes amendments and adds requirements to bills to ensure that measures are taken. This information is not that we're putting out here on this amendment. This information is not being given to the public. And I didn't know that we could tell the future whether the governor will or will not sign something. All I ask is to be collegial here and to be professional.
Thank you, Vice Speaker.
Point of
Minority
personal
Leader.
privilege, Madam Speaker.
State your point of personal privilege, Minority Leader.
Thank you, Madam Speaker. And Madam Speaker, what I said was just truth. What I said had nothing to do with offending anybody or anything. I see it the way it is, and I called it the way it is. So, thank you, Madam Speaker.
Madam Speaker, this amendment ensures that the people of Guam are brought forward if the governor should choose the need or should find the need to implement a curfew to attack this COVID-19 crisis. This virus is invincible. We see the previous speaker spraying her chair down and the desk because that's how serious it is with Lysol. So we cannot pretend like it doesn't exist.
Point of personal privilege, Madam Speaker.
But
you know, for me,
hold on.
spraying
Minority
down my
Leader.
desk with Lysol,
Minor-
I have a 91-year-old father.
And
So
my-
I'm taking precautions, Madam Speaker, because I'm here
Minority
for the
Leader,
people.
9 o'clock in the morning, where they are expected to continue dialogue on Bill 335. The Guam Department of Labor is requiring all employers and business owners who have displaced workers to register on the department's virtual one-stop system, HireGuam.com. Employers and business owners must register their organization if they are experiencing business shutdowns, layoffs, furloughs, and reduced hours caused by COVID. This requirement is authorized in one of the governor's executive orders in which businesses must comply with required reporting regarding reduction in workforce or employee hours. In news from the CNMI, the number of confirmed cases has jumped to 13. Of the 2 new cases there, both are male, a 55-year-old and a 61-year-old male. Both are in stable condition and are being closely monitored by CHCC medical teams. The cases are suggestive of community transmission within a cluster of linked cases. An update on the USS Theodore Roosevelt. As of today, 93% of USS Theodore Roosevelt crew members have been tested for COVID-19, with 589 positive and 3,922 negative results. 4,024 sailors have moved ashore. 4 sailors assigned to the USS Theodore Roosevelt are in U.S. Naval Hospital Guam being treated for COVID-19 symptoms. One of those sailors is in the ICU for increased observation due to shortness of breath. And as we reported, one sailor has passed away. His name has not yet been released. In national news, more than 1,000 Americans died of coronavirus on Monday, bringing the nation's death toll to more than 23,000. But in New York, the nation's outbreak epicenter, the governor says the number of cases has plateaued and the path to normalcy can begin. Michael George reports from Manhattan.
The number of New Yorkers calling 911 for a medical emergency has fallen dramatically in recent days. Hospitalizations and the number of people dying are also trending downward. But the burden is still heavy on funeral directors who are considered the last responders.
We're moving an average of anywhere between 30 and 40 cases a day.
The swabs used for testing remain in short supply, and New York City's health department has ordered only hospitalized patients get tested. But today, New York City's mayor announced a biotech firm in Indiana will be able to provide the city with 50,000 test kits every week, and another 50,000 per week will come from new New York City manufacturers.
For the first time, we're going to have a truly reliable, major supply of testing.
Americans are lining up at grocery stores, but there aren't any food supply shortages yet. The nation's food supply chain is being strained as workers at meat processing plants, warehouses, and groceries are coming down with the coronavirus. At Smithfield Foods in Sioux Falls, South Dakota, 300 people tested positive for COVID-19, and the plant shut down. Cases in the state have spiked to more than 100 2 days in a row, but the governor is still resisting a stay-at-home order. In Los Angeles, 4 more crew members aboard the naval hospital ship Mercy have tested positive for COVID-19, bringing the total to 7. All have been taken off the ship and put into isolation. And in the Navajo Nation, hit disproportionately hard by coronavirus, women and young people are shopping for vulnerable elders.
It's just shedding light on the disparities that have already existed and also the lack of federal funding to meet the demand of the health needs.
Navajo health officials say close proximity of families living in homesteads and those living in public housing has driven community spread. Michael George, CBS News, New York.
Cho announced today that the Federal Aviation Administration will award $20.6 million in airport aid to Guam to help respond to the COVID-19 public health emergency. This historic grant funding is part of the Trump administration's newly created Coronavirus Aid Relief and Economic Security Act, or CARES, airport grant program, which is an effort to provide unprecedented and immediate relief to American families, workers, and businesses. Chris?
Thank you so much, Sabrina. So, man, we had something come down on the news chat here, and I just wanted to get I got this info from Rory, the Port General Manager, Rory Respicio. Did you see this, Bree?
Is this the one that we got earlier? So you got a chance.
I got a chance
to speak with him? Okay.
Well, he sent me a message. He's deferring to public health, but we did get some info. We want to get these pics up on the Facebook Live to show you.
You got it. I'll show him. Them.
Okay.
I just want to make sure that he's not sharing where it came from.
Right.
Do you have it?
So
Don't share
there's an update here from the port on the marine vessel Shinyo Fortune. ALS medics are accompany the boat out to the vessel. They leave at 12 to meet the ship at 2 p.m. Boat arrival to port approximately 4 to 5 p.m. Port medical team will meet patient and ALS team at dock to complete paperwork. Patient taken to Naval Hospital. A chest pain related patient. However, destination was from China, so the patient will be considered a PUI. Medical team in complete PPEs. Coordinated with the ALS and GMH medical director, Dr. Uggan. So that's the situation there. It looks like they have a PUI that came in on a vessel into the Port Authority of Guam. So that's obviously rapidly developing and evolving, and Rory has deferred to public health. So we'll try and get some from public health on the line. Hey, remember, we're all over KUAM TV 11. Thank you, guys. And that was a deep dive into the day's COVID-19 news. We're coming back with more of Containing COVID. It's the KUAM News Takeover, Guam's favorite I-94. Good morning.
Get all the latest updates.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
KUAM.com/deals for the island's hottest promos, sales, discounts, and so much more. KUAM Deals, exclusively on KUAM.com. Find your deals today and let us help you save.
For KUAM News. And I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please stay home to protect your parents, loved ones,
Route 16, Army Drive, this the Armans the Guata Barrigada. Route 10, Vietnam Veterans Highway, this the Barrigada is the Guata Salampago. Route 4, Chang Canton Tasi, this the Agatna is the Salampago. Then Route 14, Chalantan Victorious Gizatomon. Por favor, fan responsable gisan mitsu. Gazangin parong gimen at kahot at parong fanuli marijuana na siguro na goho protegigimen pat bulatsu para gwizaon siniguni. Gazangin maluwag Canton Chalan at siguro na unsa na dahi pinakat mo. Mungo malong gitalo gitalan Jones kapadya Josiah na lugar.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war.
Local Fridays edition. That's Chris Boomer. Leave the light on. It's 8:30, the 15th day of April. It has been exactly 1 month since the governor announced the first 3 COVID-19 positive patients, and it seems like a lot longer. And someone we want to get onto the show here to kind of chat with us about what the Guam Police Department has been up to. Let's welcome to the program GPD Chief Steve Ignacio. Good morning, Chief.
Morning, Chris. How are you?
We got Sabrina here too.
Hey, good morning, Sabrina.
Hi, good morning.
Chief, let's just backtrack. I haven't heard from you in a minute. How was your Easter?
Very uneventful. Stayed home most of the day.
That's good.
Yeah, that's good. Yep. Stay home.
Stay home. That's right. Stay home.
So, Chief, I guess we just called you for an update. Can you just kind of start back and give us an idea of what the Guam Police Department, maybe first we could start with, there's been some incidents of crime out there. where are we with patrols? And I know that some of the manpower is being used at the road closures. So just, I guess, what can you tell us on the status of police officers out there patrolling the neighborhoods?
So, Chris, the patrol element or the Patrol Operations Bureau is always going to be intact no matter what is going on in our community, whether it be a typhoon, a tropical storm, or in this case, the coronavirus. We always plan to make sure that at all times the patrol operations is manned 24/7. So we make sure that we have enough personnel to meet the patrol requirements at all times. And then from there, once we figure out what the people are, the personnel are that we can pull off to help with the other assignments. So, as we continue to move forward, we've actually identified some of the officers from the initial security assignment for the coronavirus, and we're taking them out over the weekend, and we're putting them back to the patrol operations.
Mm-hmm.
Patrol operations is the backbone of the Guam Police Department.
Right. And I understand that GPD, you guys are being augmented by other law enforcement agencies?
Yes, Sabrina. I'd like to thank, the Guam Customs and Quarantine Agency, the Judiciary of Guam. We have the marshals, and we have the school resource and school attendance officers, and the conservation officers from the Department of Agriculture.
Mm-hmm. And so are they out on patrol as well?
No, they are assisting us with primarily with the security at the different facilities that we're providing security for.
Oh, I see. Okay. I did want to ask about, there was an incident that occurred at the Harmon Breeze Apartments.
Yes.
And, people, that's just one example of how people are really starting to feel very scared and frightened. And then you have these curfew violators, these knuckleheads that are running around in the middle of the night and, breaking into people's homes. And maybe just something that you can say to help alleviate the fears and the anxiety that people are having now.
Yes, Sabrina, thanks. That's a good question. So, again, we go back to the concept that at all times, there's always a patrol operations, and the patrolmen are always available. In the case of the Harmon Breeze, we were able to make an apprehension, I think, that same evening, if not the next day. So, regardless of what's going on in the community with coronavirus, we're still responding to and dealing with these cases as they come, making sure that we give them the full attention that they deserve.
Chief, I got to ask if you guys are at all aware of the Attorney General's. They booked and released a couple of these teenagers who were involved. And, he had released a statement that I'm trying to find here.
I have it.
Okay.
I want to make sure it's the right one because I think I got two. So his statement was, the offenders were issued a notice to appear within 3 years. There is a major concern with individuals who are arrested and confined introducing the virus to the prison population. It is our understanding that DOC has been in contact with public health for guidance as we deal with this public health emergency. The AG's office, along with many other jurisdictions in the nation, have to weigh concerns of spreading the virus to correctional employees, the prison population, and our community in general against the immediate incarceration of offenders. The Judiciary of Guam's administrative orders, coupled with guidance DOC received from public health, also helped to frame the Attorney General's decision on whether or not to confine or issue notice to appear to offenders. The OAG still continues to recommend confinement for defendants who pose the highest risk of danger to the community and will continue to put careful thought into its decisions during the quarantine period and beyond. This is in line with what is happening all across the country, and we, along with law enforcement agencies and stakeholders like public health, will continue to do what we can to keep our community safe from the virus while balancing the need to hold offenders accountable for their actions. As we move through this unprecedented territory in dealing with the pandemic, we ask the community to stay informed and keep open communication with our office.
Yes. I understand the concerns that the Attorney General has, and I do recall that I think an employee of the Department of Corrections may have tested positive. So those are valid concerns. However, I don't control what the decisions of the Attorney General office.
Right. How does it make you feel, though, Chief, to know that your officers are out here responding to things? We interviewed the victim in this case, and they had said that when they saw the perps trying to break into the cars, they called them out, hey, what are you doing? Get out of here. And the neighbors came out, and it was at that point that the perps were then said, we were going to kill you, and they started throwing hollow blocks. I'm sure you've seen the pictures. But
and I'm sure the victims, not just the ones you interviewed, but all the other victims within that apartment complex. I'm sure they were fearful for their lives, and we responded appropriately, and we took the appropriate action. But the decisions of other agencies outside of the Guam Police Department, unfortunately, is beyond anything that I can control.
Right.
I have read stories of other jurisdictions, though, where they have done early release of prisoners or inmates, sharing those same concerns about the spread of coronavirus.
Right, and so we did see the Department of Corrections release some pretrial detainees.
Right, and according to Lieutenant Governor Josh Tenorio, when we interviewed him last week, the release of the pretrial detainees was based on them having a non-violent
and this is a violent
offense.
crime. Yeah.
Yes, and again, like I said, I am not sure what guidance the Attorney General was giving. I respect his decision. He is the in charge of the Attorney General's office, and they decide how to prosecute cases.
I think it's weak, Chief, and I feel for you guys because, people throw it on you. What are they going to say? Oh, Guam Police Department, not bad, but you guys are doing it. You're going out there, you're busting these guys, even with all this COVID-19 going on, and then we get some harebrained excuse that, they're going to let them out. Because what kind of message does that send? That sends the message out there to, like, these knuckleheads who are going to threaten our citizens that if they get arrested, they're going to get released because, we don't want them to catch COVID.
Again, Chris, understandably, there's fears and concerns, and then we take that and balance with all the other issues that we're facing.
Right. Mm-hmm. Okay, Chief, I feel you.
Yeah, and so obviously
there's
nothing.
Better answer, and I understand also the fears and concerns of the victims themselves, right. Because again, we go back to the concept that these victims feel like they're being victimized now by the criminal justice system.
Right.
Right.
Yeah.
So, I know Paul's mentioned this, the importance of the neighborhood watch programs, and at this point we have to look out for each other. And if you could also just stress the importance of that.
Sure. We rely on our neighborhood watch programs. Not just to help the Guam Police Department, but also, to keep each other safe as neighborhood watch groups. I've been I'm still a part of many neighborhood watch chat groups, and they do a very excellent job at watching out for each other. And so, I like to applaud the different neighborhood watch groups and the mayor's offices and their efforts, to get these neighborhood watch programs started and working with us to collaborate, to help keep their community safe.
Okay. Is there anything else you wanted to add, or maybe you plan on talking with the AG or public health or whoever you need to talk to about maybe finding some sort of a better solution other than, book and release? I'm not sure what's the criteria that you decide who gets to be booked and released, or are we just book and releasing everybody? Are we confining anybody? And you don't have the answer to that question.
Right. Yeah, we have a criteria. We do confine people, especially in violent crimes such as the one at Harmon Reed's apartments, and again, the AG's the AG's office probably has a different criteria. Understandably, I think if these were different times and we weren't dealing with coronavirus, I think I strongly believe that there would have been a different outcome. But unfortunately, we are trying to balance the needs of the community, meeting the expectations of the victims in our community. But also realizing that these are very different times that we're having to deal with.
Mm-hmm.
Just have to sort through it. This is unprecedented. In my 32 years, I've never dealt with a pandemic like this, and it's a learning experience for the entire community.
All right. Anything else, Chief?
No, I'd like to thank you for inviting me out to the show. You know, it's been a while. Yes, I miss having the interaction with KOM and the reporters. I look forward to getting past this so we can meet up again.
All right.
Yeah, us too, Chief. We miss you.
All right, Chris. Miss you
Be
guys.
safe. Be safe.
Wash your hands, Chief.
I will. Wear
Okay.
your face mask, Chris.
Always. Mask up, 840. That's GPD Police Chief Steve Ignacio. You can feel the frustration. I mean, he's a classy guy. He's never going to really, backtalk or downspeak anybody. But I think he's clear, hey, it's not our call.
Yeah. And, we did put in a call to the Attorney General's office actually yesterday to try and get an interview with him and give him the opportunity to kind of explain this whole book and release, book and confine process so that everybody understands the rationale behind the decisions that are being made and why they're important, I guess. So hopefully we can still get that interview before we run out of time today.
Yeah, I just texted Carlina because, what I thought was problematic, Bree, and this is a little BTS information, but, Attorney General's elected to a 4-year office, and in putting out a decision like this that has wide-reaching ramifications to the public, to victims of crime, and to the criminals, I think that they need to stand up and answer the questions. Mm-hmm. And so the response we got was, could you send a bullet point list of any questions you might have? I mean, put on your big boy pants and stand in the fire, and people have concerns. They're concerned. I mean, you're setting criminals free, and these particular criminals threaten the lives of the victims. And so now we have the victims. You look them, they can't believe it. Like Chief Ignacio said, they feel like they're being not only victimized by the criminals in this case, but being victimized by the criminal justice system, which is the last thing you want in a situation like this, because it's blood in the water. And once all these criminals know that Attorney General Levin Camacho is just going to set them free if they do something, and we don't know what the parameters are, so that's why we would like some clarity on it, because I think it's troubling. It's very, very troubling, especially for the public out here. We're being told to shelter in place. All these criminals, they know where we're at, and a lot of them are thinking about coming to get us. So neighborhood watch is all good and fine, but it only goes so far, and we've GPD's doing their part, so I'm not really sure what. Yeah, Jay.
Okay, I wanted to add a couple comments. We got a comment speaking about this very hot, contentious issue. Obviously, Pat Gunn was saying, why don't you lock the criminals in the kennels at Gain if the AG doesn't want to do anything?
First, let's just clarify that the people that are being arrested, they're accused, okay?
Yeah, right. Of course.
They haven't been convicted of a crime. But
Right. You still got to follow procedure.
I'm just saying.
But under normal circumstances, they would be booked and confined, I'm pretty sure.
Depending on the crime.
Right. Yeah. And I think that they need to look at the circumstances of this crime and see where the victims were saying that there was threat made to their life, and that there was also a threat that they were going to come back. Mm-hmm. And so that's what I think. I mean, are we really... That's just...
Well, Angelo actually throws in a comment after that, and he says, I hope people won't resort to taking matters into their own hands.
Of course they're going to.
Well,
because now that's the option that they have. If the AG is not going to keep these guys behind bars because, the risk to the prison.
Well, GPD, I've interviewed, Sergeant Paul Tapao many times and the chief a couple times, and they say vigilantism is a very, very dangerous thing, and they're like, do not, if you're not deputized, do not go down that route, but you can take matters.
You have the right to protect
protect yourself
but
and
you
your
have
family.
the right, but you also have the power
to kill. If they come onto your property and castle, you have the right to protect yourself, and I don't blame anybody who's going to do that.
But what people are saying is do what the chief said, join those neighborhood watch groups. Everybody's home anyway, so you might as well jump on Facebook. If you see something, report it. The discussions are incredibly lively.
Right.
The Dedido neighborhood watch group is like very, very active.
But Jay,
help GPD.
These victims were in a neighborhood watch group, and it was in the chat,
That's
and
a
they
good point.
did everything. Jesus Christ, give us a
It was
hand
at,
here.
Easter Sunday, 2:00 in the morning.
Give us a hand, Mr. Attorney General.
Okay, well, the number you can call is 637-0094. Hope to hear from you.
All right, so we're going to take a little break here. It's 8:45. The Containing COVID KUM News Takeover, Guam's favorite, I-94.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
working hard to keep you safe. Wash your hands.
Stay home.
Top of the day, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row.
Hey, good morning, Guam. Containing COVID. We do have the Attorney General was able to call in, but I wanted to just read this, and I really appreciate him calling in, with everything we said. I think that this is something that he's going to have to sell it to the public, you know what I mean? But I just wanted to do this Facebook post from the victim. Now, it was there were a whole apartment complex of victims. We were able to interview the wife of this gentleman who posted on his Facebook yesterday after getting the update that the two perps were released. Update, got off the phone with the AG's office, and the two punks will be released back into the community at 6 p.m. tonight. I am losing all hope with Guam's justice system because they said the case will be looked at after the COVID-19 lockdown. I guess my family's lives can be brushed off that easily. This means I will have to take matters into my own hands. I might need some help because they will be back. And so I want to bring AG Camacho. AG, first of all, thanks for calling in and addressing this.
Yeah, no problem, Chris.
So how would you respond first to that victim? Because, with Chief Ignacio, obviously he seemed kind of frustrated and that, they're going out, they're making their arrests. And maybe if you could just explain to the public where you guys are coming from.
Yeah, I mean, are you hearing an echo on your side? Sorry, I'm just
Yes, we can hear you.
Yeah, we can.
Okay. We know that, I don't have to repeat that we have COVID-19 issues on Guam, and that we know that it spreads much more easily when there is a large concentration of people in confined spaces. And, just listening to the news, you have the aircraft carrier that's here. You talk about cruise ships. And prisons, unfortunately, would meet those criteria. So we know nationally that that COVID-19 would be a huge threat to anyone who's in prison, and an introduction of COVID-19 at DOC would be terrible not only for the correctional officers and the prisoners there, but also for the island because we're trying to buy time and increase capacity as well as testing. So we've made a decision as we look through every individual case, and there's going to be a spectrum, but the easiest one would be nonviolent offenses. The presumption is that they will be booked and released, and they'll be given an NTA to appear. And after things start going back to normal, we'll start reviewing those cases and charging where appropriate. And then on the other extreme would be the most violent offenses, which would be rape, murder. If those kinds of offenses are happening, obviously we're going to ask for a book and confine. But, there's a lot of cases that are kind of in between. So property crime, as an example, if someone goes out and bashes your car, you could say it's violent because it's property and someone's doing a violent act, but it's not neatly within the nonviolent or rape or murder. So that's where we have to rely on our prosecutors to exercise their discretion right now. And, the guidance that we're being given is to try to minimize as much as we can introduction of anyone with COVID-19 into DOC. So we're doing the best that we can. I'm aware of this one case. We're looking and seeing what happened. But I can tell you that we get the reports from GPD, we review it, and that's what we base our decision off of.
So based on the report that you received, this wasn't violent enough for somebody to go and break into somebody's house? And knowing the victim said that this is the same group of people that came just a couple weeks ago and stole their car.
I haven't seen police reports, Sabrina, and I don't think you have either. So I can't really say in terms of how this investigation was handled or what was given.
I didn't need to see the police report because we spoke with the victim.
I understand, but our office doesn't get to speak with the victims. We have to rely on the reports that we
Don't you guys have a victim or some kind of victim helpline or something that you guys talk to victims, AG?
Yes, we do. So after we received the reports, and I believe that's what the victim mentioned, that our office contacted him or the family. So they're doing the best that they can, but when we get information, our police reports, that's what we have to base these decisions off of. So could things, was there a potential mistake that was made in this process? We're going to look at it. I mean, obviously, we're 30 days in right now, and this is the first case that I'm aware of where there's a victim that's extremely upset, and then again, there's a spectrum of property crime to violent crime. So we're going to look and see what happened in this particular case, and to make sure that we do everything that we can to that we're doing the right thing. But I just think people need to understand that there's a arrest, we get a call, we get reports, we make the decision based off the reports that we receive. But we're not the people on the ground, on the floor, or on the ground.
Are you throwing the GPD officers under the bus for the report, or?
Not at all. I mean, they're having to prepare their reports, and again, I think people need to understand the system. If you have multiple officers that are responding, we're trying to get the reports, to download the reports, to review the reports, to make decisions. So if we get a report that's an interview with the victim that comes in after a decision has been made, then we have to figure out a way that that's not going to happen. But my understanding is that the decision was made based on the information that we had at the time. And again, if there's things that need to be corrected, then we'll do that.
What would your message be to those victims out there who are now having to digest this information that, the AG's office, I mean, you guys have discretion all the time, I understand that. But that, the message it sends to these criminals that, DOC's got COVID, because it's a clear message, AG. Now people think that they're not going to go to jail if they commit crimes. And that's just the reality of it.
Until we come up with more testing, I mean, and again, this is not just limited to DOC. As an island, we need more testing. But, you're talking about 700 prisoners, probably dozens of correctional officers. And then on top of that, once we hit, the 15 ICU beds, we're going to see a lot more people dying. So that's the balance that we have to strike. And that's not an easy one to do. Obviously, if we were not in a situation where we had COVID-19, things would be different. But that's not where we're at right now. So we're going to do the best that we can given the constraints that we're given. But, there's no easy solution. Either you're going to potentially put everyone at risk on the island and in DOC, or you're going to have to make some of these tough calls. But again, this is somewhere within the spectrum. Possession of drugs that we normally would book and confine, or drug dealer. I mean, don't commit crime, and we're seeing most people are following the governor's orders, and we're going to do our best again to improve on the process. But we're 30 days in right now. This is one case within the last 30 days, and again, I feel for the victim. I mean, our office has already reached out. We're going to keep those lines of communication open and do what we can. But the courts are closed, guys, and there's no trials. They've suspended everything until May 6th. They've suspended the grand jury proceedings until May 6th. So it's not just an AG's office, a GPD office. The entire criminal justice system on Guam and around the country is having to deal with this. And we're all in line with the measures that we're taking.
Yeah, but it's the members of the public that are really having to deal with it because, criminals are being set free. And in this specific case, no matter what the police report said, the victim said that there was a threat made to their perps are like, we're going to kill you guys. And so I'm not really, I know the discretion, right?
I mean, you guys have access to stuff that we don't, get to go out and to interview victims within the time of, that's something, again, we have to rely on GPD to do. So.
For clarification, is everybody getting issued an
No.
notice to appear?
No, not everyone. So there have been cases where we have booked and confined, and we've requested that they be held pending cash bail.
And can you just go over again the criteria on how the prosecutors decide?
Again, you have nonviolent offenses, which
what's nonviolent?
Possession of a controlled substance would probably be an easiest one. If you are caught with pipe and residue, we're not going to ask for you to be booked and confined and brought MAGI right now. On the other end of the spectrum, rape. If you are accused of sexual assault, we're going to request that you be booked and confined.
What about, so this was this terrorizing? Was this the charges that these two guys were facing?
Again, Chris, I don't have the police reports in front of me. I haven't looked at the police reports. I don't know what was in there. I know based on the report that you've given, there were threats that were made. That's in your report. There's damaged property. But what I read was that there was a report of people damaging vehicles, and then it escalated because someone went out and confronted them. So I don't know the specifics of it. I don't know what the evidence is going to support in terms of charging.
But you can see how this would look to people out there.
Absolutely, Chris. And again, I am frustrated too. Our prosecutors are frustrated because we want to be doing our jobs, but this is what we're trying to balance at the end of the day. And you can go in and you can book and confine it. That's the one person that's positive for COVID-19, and now we've put hundreds of people's lives in danger. So that is the balance that our prosecutors are having to strike every day, and it's not an easy one to do because we're not operating under normal circumstances. So the sooner that we can get back into our courts being open, trials happening, then that'll be good for everyone, including victims. We want that as much as anybody else does.
We had a comment here on our Facebook, AG. Why was this issue not addressed in the first place? Now it comes to this. Was this a case of poor planning? You mentioned we're 30 days in. We're and I know the developments at DLC with COVID are a little more recent, but was this idea of not confining nonviolent offenders something that had been in place since we started the COVID measures?
Yes. I mean, the courts already started scaling back, I believe, March 16. They had one day that I think that they did essential trials, but everyone has been trying to adapt to this and to listen. You can't social isolate in prison. There's not a bunch of hand sanitizers in prison. So I think everyone across the country has recognized the potential danger that introduction of COVID-19 into our prison system would pose. The courts also have suspended anyone reporting who normally report on the weekend to go to DOC. They've suspended that through May 6th. So I think the entire criminal justice system has had to adjust, knowing just how much of a threat it would be if someone were to have COVID-19 and were to be incarcerated at this point.
What would your message be to those would-be criminals out there who are listening to this and
thinking they're going to get a free pass?
Yeah, okay, property crime's okay. We can go bash cars, that's cool, okay. Possession, yep. Selling drugs, got it, green light. You know what I'm saying, AG? That's kind of what the message is.
We're going to hold people accountable. And once we can go back to, once we've established a more robust testing capabilities and we've increased our ICU, it's just a matter of time before we start to phase back in. And when that does, we are monitoring these cases and we're prepared to charge them. We just want to do so in a safe way.
Mm-hmm. Now that we talked about the arrestees, what about the pretrial detainees that are already inside DOC? Are you guys monitoring who's being released?
I know that there's a process for that, and ultimately, once the case has been initiated, the decision to release is left up to the courts.
Mm-hmm.
We're working with the courts and with public defenders to see, and again, it will be non-violent offenders. We are looking at everything on a case-by-case basis. We're not releasing any violent offenders.
AG, I know that you said that you didn't have this case file in front of you, but is this something that when I don't know if you're working remotely, is this something you're going to look through it and maybe make a determination if the prosecutor made the right call, or is it just a done deal?
Again, I don't think people realize just what our prosecutors have to go through every day. So we're going to look into see if there is a way that we can improve the communication, and if we didn't get information or there was information that was out there and somehow our office missed it, we'll review it. But we're aware of it. If a mistake was made, then we're going to address it.
Okay, it's a tough pill to swallow, but hey, I think if people hear that you wanna at least do the right thing,
maybe even just respond to what the chief of police said, that victims are now feeling that they're being victimized by
the criminal justice system. Yeah.
Again, we're trying to get back to things as being as normal as we can as soon as we can. And I feel for the victims. I would hate to be in the position that they're in right now. I've read through your story, the other accounts, and it sounds terrifying. But I just think people need to understand our office is making decisions based on the information that we have. We're not saying criminals all go out there and commit crimes now. And I guess if we get to the point where you're right and that's what people are doing, then we're going to have to book and confine at that point. And you're right, maybe DOC would have to figure it out, or a government will have to figure it out. But I would hate to be the person that we put someone in DOC who's COVID-19 positive, and we end up with
right. But AG,
positive now.
Would you hate to be the person who releases a criminal who goes back to the scene of the crime and murders someone?
Absolutely. And again, murder is not one of those kinds of things where we're not going to ask for an NTA to come back in 3 years. So.
Right.
We're going to
but in this case specifically, AG, where you have the threats were made, we talked to the victim. I know you didn't talk to the victim, but you release these guys, and if they go back to the scene of the crime and do something, God forbid, we shouldn't wait for them to have to kill somebody so they can go to jail. But if that happens,
Chris, if it escalates, and again, it's clear there's an assault or there's a serious violent act, there's going to be a book and confine. I'm confident, not in this case or any other case. I just didn't, again, I have only seen what the reports have said, where there was damage to vehicles, and I saw a picture of a rock through a window. I don't know what reports our office had a chance to review before making the decision. But if there is a violent act, we're going to charge it out, and we're going to ask for confinement.
Okay, so just so we're clear, then the decision is made based the decisions are made on the NTAs, on the individual prosecutors, based on the reports that they see that are filed by the police department.
That's correct.
Okay.
And that's whether now or before. That's always the way it's been happening.
Okay. I wanted to move on and just ask you really quickly. You know, the governor, she's been saying this that her decisions that she's been making is based on AG's input regarding these stepped up social distancing measures, such as the limiting of travel, implementing checkpoints, mandatory curfew. Can you explain what she's talking about?
You know, Sabrina, I feel I heard this example that like the house is on fire and there are some people who are worrying that maybe we're using too much water to put it out. You know, we're 30 days in. I think the governor is implementing these measures based on recommendations by her medical team and public health officials to try to get us to the testing implementation. So she can enter these orders, and she cited to Title 10, Chapter 19 under her, because we are in a public health emergency, an unprecedented one. But what that chapter does not provide for is an enforcement mechanism. So Chief was just on, and I've talked to him before about, you know, AG, what do we do if we go to the beach and there's a party of 20 people, and they're basically saying you can't do anything. Mm-hmm. What are you going to do about it, right? So that's the reality of the people that are on the ground trying to do their best to make sure people are following the governor's directives. And as of right now, there is no mechanism for that.
Okay.
Everything's on our system at this point. So.
What about the suspension of the open government law, AG? Was that necessary?
Again, this is something that's happening across the country where it's harder to have face-to-face meetings, and I'm sure that as we get back to normal, you know, if agencies can put together social distancing measures and make sure no one's within 6 feet of one another, whether it's necessary or not, I think there are some agencies that need to continue to conduct business. And I'm hopeful that we'll figure out a way to move forward with technology. My understanding is that we're hosting on our website meetings that are being held. There's been about 3 that I've seen. So I'm not sure the concern over the last 30 days for what exactly people are worried about.
Okay.
Well, thanks, AG, for providing that clarification to the listeners and the public and the victims and the criminals.
Well, I mean, we're doing our best, guys. I don't know what to say. You know, we've been told that there's a huge concern about what it would mean for our healthcare system, not individuals, but our healthcare system, if there was an outbreak of COVID-19 in prison. So we are trying to make that determination on a case-by-case basis with the information that we have. It's not going to make anyone happy. I mean, we're not happy with it. I'm sure victims are not happy with it. No one's happy with it right now. But once we can get back to normal, things are going to correct.
Okay. Well, thanks, AG. Yeah, you're right. That's a tough one to put out there. But, obviously the people in charge have come up with this, and we just got to deal with it. Yep. Okay, AG, thanks.
Thank you.
Be safe.
Yeah, wash your hands. All right. Well, there you go. AG leaving Camacho. Boy, that was a lot to take on. I need to decompress.
I know. I think you need to go to a break or something.
Yeah, we're going to go to a break, and we're coming back with former Senator Dennis Rodriguez and talk about something he's pitching that involves mass community testing and the Speaker Tina Munia Barnes' COVID-19.
I was going to say, it looks like we need to start a DOC so we can just go to break.
Okay, we'll be back. It's Containing COVID. Hey, we're KUAM-FM, Hagatni, Guam. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Specialist Joshua Mancinot here. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
We're working hard to keep you safe. Wash your hands.
Stay home.
On the Facebook Live, what was it, Bree?
Oh, I just kind of scrolled past
Okay.
it. It said, "Stop being ridiculous."
Right, and
Something like that.
He said something like, "Oh, you know, if anyone commits murder, they're going to go to jail." Yes, I understand that, but the question I was trying to ask the AG was, if we have criminals who threaten to kill people, they get booked and released, and they go back and return to the scene of the crime and kill somebody. Yes, they're going to go to jail, but you're still going to have a dead person. That's the point I was trying to make, because the AG said, you know, it would weigh heavy on him if these people went into DOC and got COVID. So obviously the other side of that is, would it weigh heavy on you if there was a, you know, repercussion for the action that you did? We got a lot of comments on this, so we're going to bring on Jay to kind of read through these and then get former Senator Dennis Rodriguez on. And thank you, Steve, Steve, for your comments, and thanks for watching the show. Appreciate it.
Okay, yeah. No other interview that we've had this morning drew as large or as vitriolic, I would say, as a response as that one right now. The sentiment so far, when, you know, I mean, granted, like you said, Chris, I mean, the AG was very gracious to give us some time. I mean, he spoke very frankly, but people were not satisfied with that response. Obviously, let me see if I can just page through some of these, because we got a lot. Again, somebody was saying, is it actually is it a possibility where you could put them in the gain kennels? I mean, I don't know about that.
Yeah, that's ridiculous. Yeah, you think I'm being ridiculous?
Yeah. Some people are echoing what you said, because, you know, you brought up the Castle Doctrine thing, you know, like maybe about 20 minutes ago. People are like, okay, I remember that. Now people are going to start looking into it. We're all home. People are going to start actually reading up on policy. Some people are saying, AG, you're supposed to defend the people as well as like follow the law. We get it. You also, you serve at the will of the governor, but you also serve at the will of the taxpayers. So
he doesn't serve at the will of the governor. He's an elected AG. He's supposed to be independent of the governor. That's kind of how it works.
And people are also saying, they believe that the criminals are now listening, watching on this, Our friend Sergeant Paul Tapau also said that one of the benefits of doing things in group chats, on Facebook groups, on social media and everything like that, the criminals sometimes they go in there and GPD tries to use counterintelligence because they go in there and they see what kind of conversations are growing, because then the criminals themselves will listen in, try and do stuff. So I mean, hopefully we had some people. You know what? Okay, there are a lot of people obviously venting their frustration with this issue. You can scroll back through the comments, some really interesting things. We'd like to now challenge you guys. What do you have as far as solutions? What creative ways can you think that we could, keep neighborhoods safer? I mean, obviously none of us are policymakers, and the vast majority of the people watching this right now don't have that authority.
Jay, I think that they already kind of were working on decreasing the overcrowding of the prison by releasing the nonviolent pretrial detainees. But I think, like the AG said, I mean, to be fair, it's a case-by-case basis. He hadn't seen the police reports, neither have we, which you made a big point about. But yeah, I think the solution is you do what you can to keep these criminals who threaten people's lives locked up. It's pretty simple. It's not rocket surgery. Okay, is that it?
Yeah.
All right.
Lot of comments and everything, so keep them coming.
Thank you, Jay. So we're going to go to the phones here. Bree, can you kind of back us up on this? We're going to bring former Senator Dennis Rodriguez. So there was something that came out yesterday from Speaker Tina Munia Barnes, and she has a COVID-19 medical advisory team of her own.
Right. She wrote a letter. Let me pull it up. She wrote a letter to the governor talking about her COVID-19 advisory group. They held their first meeting, I believe it was yesterday, and she wrote a letter requesting that they meet with the governor's medical advisory group and collaborate. And, yesterday we reported that the governor of the CNMI, he managed to get 20,000 rapid test kits, and plans to have at least a total of 60 by the end of this week to do these community testing. So, the speaker wrote a letter and she said, we know that, slowing the spread can be done through social distancing, but there's also this other way through mass testing. And so former Senator Dennis Rodriguez Jr. is actually on that
committee
advisory group.
Yeah, so let's bring him up.
He also wrote a letter to the governor's medical advisory group with a plan on doing mass testing.
Right, so let's bring up former Senator Dennis Rodriguez. Good morning, Senator.
Good morning, Hafaday, Chris, and Bree.
First of all, it's been a minute. How you doing?
I'm doing very good, thank you. I hope you guys are doing well and staying safe as well.
How was your Easter?
Very good. Very simple. Just with the family, all day, every day with them, and it's great.
Okay.
So tell us about the advisory group that you're on with the speaker.
Yeah, and how did this end up getting formed, Senator?
Well, the speaker had called me a few days ago and asked me to be part of her advisory committee, COVID advisory committee. The speaker is very concerned about the situation and how they could, as policymakers, respond, to the recovery and respond to the aftermath, when that day ever comes. And so she's put together some people she believes that can help her.
Mm-hmm.
I'm given, whatever 2 cents I could provide her. And when she did call me, I did mention to her that as a Total Guam Foundation, and if I can speak a little bit about the foundation. We were established officially established in 2017. We're actually doing the work before that, but officially through getting it through Reventak and the paperwork was in 2017. We're a registered 501c3 nonprofit charitable healthcare organization, and really our main mission is to provide healthcare access to those who don't have insurance or who are underinsured. And so we've provided a great amount of service to the people of Guam through our volunteer doctors in the community, volunteer individuals. We do it through our mobile care clinic. We go out, make it easy for people because we understand people have impediments. They don't have transportation, or they're, just different types of barriers. So we bring the services to them. And so we've continued that mission, and that's what we've been doing. And what we've, as an organization, when this emergency came up is we're thinking, how can we continue to help our people, those that we service, those who are part of our mission. And we're very concerned that the testings right now, and this is understandable that it's limited, and so there's restrictions in place on who can be tested. You must fall within certain criteria. And so, we want to be able to offer our assistance to the government and be able to service those in the community that perhaps fall outside of those restrictions. That's our first mission. And number two, we know too that based on science, based on what other countries that are showing some sort of success, is that you got to be able to have these mass testings done, be able to know who are infected, treat them, isolate them, and those who are not infected, be able to get them back up and get our island back up and running. Mm-hmm. And so, we've the foundation has reached out to the governor's medical advisory committee, and we told them we have through our global healthcare network, we're able to provide a mobile laboratory that's fully equipped to do about at least 450 tests a day. And so, we know that, of course, through, our organization, we go through private donations, private financing. And so we've talked to some of those people already, and people are ready to help get this here. But the first component is we need the partnership, we need the approval of the government of Guam. And so that's why we wrote to them. We said this is what we can do. We have test kits. We have initial supply of 20,000 test kits that we can get to the island within, I believe, 25 days, with a fully equipped mobile laboratory. Mm-hmm. And so that's where it's at. And when I mentioned that to the speaker and to our advisory group, the speaker at first was saying, great, let's try to do this. She's been trying to advocate for mass testing, I believe. She had mentioned that to me. And so, there's a lot of impediments and roadblocks in getting it through, just like anything else. But, Chris and Bree, if there's any silver lining in this public health emergency, is that the federal government has provided us tools that help break down these barriers. Now that, with this public health emergency, the federal government has authorized local, state, and territories to be able to establish their own testing criteria, and so either through legislation or I believe through the governor's authority. So these things are possible, and so we're here as a foundation just offering our assistance, and if called upon, then we'll answer the call.
And so I know that you wrote this letter to the governor's main person, Dr. Mike Cruz, who is in charge of the Physicians Advisory Group. That was April 9th. Have you received any response from him, or?
No, not yet. We haven't, and I'm sure that they're reviewing it and seeing what needs to be done. And so when I always believe everything is done through God's graces and through His intervention. And so when the speaker had called me, I believe on Sunday evening, and asked me to do this, I said, well, Speaker, this is something that the foundation has initiated. Take a look at it. And she says, well, let's do this, And so she offered to write to them and ask them to review this and take a look at it. And so, we're hopeful that everyone is trying to work very hard to get this crisis addressed, and so I'm hoping that they'll be able to take a look at this also.
So these test kits that you were referring to, the 20,000 test kits, are these the same Solgent, right? From Solgent, the same test kits that the CNMI has?
Solgent is the biotech firm from South Korea, and they do have several different types of test kits, but the ones that we have offered are the PCR testing method. I believe that may be the same as what the CNMI had received, and also from reports that we're seeing, this is also the same type of test kits that the federal government through FEMA has purchased from South Korea firm, and is providing to several states, and also putting into the national stockpile. I know also that I heard Director Denorsi earlier that these are not FDA approved at this time. However, I understand that a EUA, which is an emergency use authorization, I believe it's called, has been submitted to the FDA. And so what happens then is that the process is that when that is submitted, that triggers the ability of these test kits to be distributed prior to receiving an EUA. And so, that's how I believe the CNMI is able to accept it. That's how other states are able to accept it. And also the fact that there's current guidance, current regulations that allow states and territories to come up with their own testing criteria, to allow specific testing kits, is something that I believe we should take advantage of.
Point of personal privilege, Senator.
Hey, I don't miss those.
So we had Linda Denorsi from Public Health on in the 7 o'clock hour, and I don't know if you caught it, but she seemed pretty firm on that. Since there's no EUA already in place for these test kits from South Korea, that they don't think that it's prudent to use them. And she had said that the NMI was also not going to be using them to diagnose.
It's going to be more of a
surveillance.
Yeah.
Right, yeah.
Yeah.
So I'm not really sure. And then, so Senator, if you could just maybe, if we already have that kind of firm stance from Linda, and as the Chief Public Health Officer, she's kind of leading the charge on this. How much are we going to continue to push for this, or do you think that when that EUA does get into place, that maybe that changes things?
Well, first of all, the foundation is not pushing it. The foundation is offering, because we believe that Guam needs an additional testing capacity, and so and I respect that. If they don't want to come up with their own regulations, the Speaker is aware of this. The Speaker, the legislature, the senators could come up with establishing laws that allow for Guam-specific testing criteria. So those options are all on the table, and it's really up to our leaders to determine whether mass testing is a priority. And so on the foundation standpoint, we believe this is something that should be done in order to help protect more of our people. It's also, personally for me, I think it's something that should be done if we're trying to focus on getting our island back up and running, our economy, our schools back up, our prisons. I heard the AG earlier. And so if without mass testing, are we going to shelter in place for any time longer? And understand these things are working. We have to recognize that. These social isolations, these orders are working. But when is the end sight? And when we do get to that end point, how are we going to determine whether, hey, this person is not infected, this person is infected? And so, I believe we should learn from what other countries, other jurisdictions are doing. And there's no doubt, there's no argument that mass testing is the way to address this and to truly curb the that peak that everyone's talking about.
Can you tell me then a little bit more about the proposal, so people have a better idea of what you submitted to the governor's advisory group? Because I'm looking at it, it talks about a mobile laboratory, on-site molecular diagnostic testing, including a container laboratory shell, mechanical and electrical installation, water service, HVAC, and storage. Is this different from what you currently have? Because I know you have a mobile clinic, but is this something completely separate?
Yeah, it's completely separate. Our mobile clinic, early on in the foundation's answer to a call from GRMC, GRMC is actually using our mobile clinic now as their emergency triage outpost. It's parked right outside the emergency room, and so they wanted to, in their effort to keep that a COVID-free hospital. I believe their intent was to use that to triage anyone that's coming into the emergency room, and use that to help in that effort. And so that's totally different from the proposal that we have offered. It's a fully equipped mobile laboratory, and this is one option. This is an option to get because we know the concept of the mobile clinic going village to village and servicing people where they're at. So with this, it's similar to what I guess you would see what's happening in the States and the U.S. mainland about these drive-through testings, right? With this, though, it takes into consideration the self-isolation requirements that we're in now, takes into consideration the transportation needs that people may not have. When we do go out and do our immunizations and our physical with the mobile clinic, you have residents walking to us when we're parked on the side of the road in the village because they don't have a ride. And so this is, that whole concept was meant to do that with this fully equipped mobile laboratory. If that doesn't work out, this is we can easily transform an existing facility into another clinic to support, the public health clinic, support the hospital, and GRMC, I hear, is also going to be doing testing. It's just a matter of being able to increase the testing capacity of our community.
Okay. And how much is something like this going to cost?
It really depends on what the government of Guam wants, right? There's that component of whether this is going to be a mobile laboratory, whether it's going to be a fixed laboratory at an existing facility. And so those all factor in. The global healthcare network that we are a part of has as well personnel, technicians that can be deployed to Guam. I think similar to what the CNMI has done, they brought in a pathologist, I believe, to help in this testing process. And so it really depends on what it is. I mean, we haven't discussed that with the government. Some of our board members and our donors, we've told them this can cost several $100,000, and so to prepare for that, if we are to be able to deploy this, then the private financing that needs to be raised to be able to do this, and so it really depends on what the government would want and what they would authorize.
Senator, how concerned are you about the politics of this and that he ran against the governor, and they can hold a grudge, I'm told.
I believe in people. I believe in God, that especially in times like this, that we're going to put all politics aside and do what's best for our people. I mean, being holed up in our own homes, which is good. It's good to get the chance to. I'm a homeschool teacher now. And everything
Me
else.
too.
Sabrina is too.
That's right. But, it really, I think everyone is sincere about trying to get us back into some sort of normalcy. And I'm hoping and praying, and I have faith that people as well will put politics aside and just do what's right for our community, because, this is something that no one in our lifetime, I believe, has ever experienced. And so we owe it to ourselves, we owe it to humanity to put everything aside and work together.
Amen.
All right. Senator, I got to ask you that someone had picked up a packet for you, the Guam Election Commission. I don't know if it's so. I mean, I've got you on the line, which is a rarity. Is there any intention running for public office? I know you got supporters out there. Can we speak to that? I know you might not think it's the time, but let's just clear the air.
Sure. And I know, yes, I got great friends and supporters that have been encouraging me, that have picked up a packet, have been actively, getting signatures. And I've told them that I didn't have any intentions to run for any office this year or anytime in the near future. But, I told them I respect that their desires and what they want. And so I would definitely consider it. And if that point in time comes when we need to make that decision comes, I know that I'll make a decision that's going to be good for my family, for myself, and what's good for Guam.
Okay, I wanted to just go back on track with.
Sorry, I thought you were done.
No, I wanted to ask who all is on the Speaker's COVID-19 advisory group.
Well, in the first call that we did yesterday, I know that former Senator Francis Santos was on the call. Karen Flores, I believe, is a registered nurse.
Yeah.
And then there was another individual who was on the call from. I guess he works at GRMC as well. But I'm not sure. The speaker would be better off in announcing who those members are. But again, the speaker, her intentions are what can we do to address the needs of the community. We've told her and I talked about how, besides this aspect of mass testing and the health aspect, there are people hurting right now in our community, and so she has some plans that she's working on and thinking about and how to address this, because it's real. It's very real.
We say that every day.
Yeah.
Especially with all the people that are, you're right, that are hurting out there. So anything else that you wanted to get out and we, to the
No,
community?
just follow the directives, stay home, wash your hands.
Stay home!
That's right. And pray, because the good Lord, I believe everything is done for a reason. And there's always good that comes out of anything. And in this time where we're all hurting, it's a challenging time. I truly believe that some good is going to come out of this. And, and every day my wife and I, we pray, we see it, we say, you know what, this is good. Every day we're with our sons and our daughter, we pray for her. She still works. She's an essential employee. And so, but there's going to be good in this. And I totally believe in the people of Guam, our leaders. I believe that we're all going to get through this together.
All right. Well, if you do get a response, let us know.
Yeah, keep us in the loop. Well, hey, Senator, we'll clear the floor and give it to you if you just if you need it. So you got my number. You can shoot me a message anytime.
Great. Thank you very much, Bree and Chris.
Okay.
Okay,
Be
Senator.
safe.
Wash your hands.
Bye-bye.
Bye.
Thank you.
Okay. There you go, former Senator Dennis Rodriguez. Hey, good to catch up with him. I thought it was interesting. He kept saying "believe, believe, believe," and I kept thinking of Frank Uggan and Alicia Limtiaco's slogan.
Once we get off the air,
Yeah.
I'll post the letter that he sent to Dr. Mike Cruz,
Okay.
who heads up the governor's physicians advisory group. So you can all have a better idea of what he was talking about. But he did send over his suggestion, his plan for mass testing. Jason, mass testing that you can read when we post it a little bit later.
I was going to say, people were actually saying on Twitter, and they were saying, one of the hallmarks of the senator's career when he was in the legislature was the mobile, was it the mobile clinic?
Yeah.
Yes,
the mobile lab.
Total
Yeah,
Guam.
and
Yeah,
so people were saying, I wonder if he's going to do like the reverse and be like a big advocate for the drive-through approach, which everybody seems to be really going for here in comments.
Right.
Yeah,
so
he
his
kind of-
plan kind of
yeah.
Entails this mobile clinic, not the Total Guam one, but a different
Right.
sort of mobile clinic.
Right.
Yeah.
Kind of like a drive.
So they're going to bring it out to the streets and everything.
Well, he's pitching it. They're
Yeah.
not pitching it. They presented the option, I guess.
Right. He presented the option. Then he's part of the speaker's COVID-19 advisory group.
And you
she
actually
requested yesterday to have her committee meet with the governor's advisory group.
And Bree, you actually got some love when you said amen. There's I don't know if it's a relative of yours, but Ochi Matanani was saying, I second your amen, Sabrina.
Well, I third it.
Fourth.
Okay, there you go. That's Jason Solis. Always got interesting 2 cents to add to the show. 9:35. Break Nonza. We're going to take a break. It's containing COVID, the KUAM News Takeover. Again, to all of our viewers and listeners on all of our platforms, good morning on you.
The Variety Taco 12.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
It's a dilemma or it's a bargaining tool to let her have curfew, to give her the authority to implement curfew. So,
point of personal privilege, Madam Speaker.
Please state your point of personal privilege, Vice Speaker.
The amendment are conditions if she wants to institute curfew. There's no bargain here.
Thank you, Vice Speaker. Minority Leader.
Thank you, Madam Speaker.
Please proceed.
So once again, this is a bargaining tool to give you curfew
Point of personal privilege, Madam
Oh
Speaker.
my gosh, I'm calling it the way I see
Go
it,
ahead.
and if she doesn't like it, I'm really sorry about that. But it's
Minority Leader,
technically
please.
a
There's
bargaining
been-
tool.
Minority Leader, please. You are out of order. Vice Speaker, please state your point of privilege.
The amendment is a requirement that the governor must give to the people of Guam if she is to institute a curfew. It is not a bargaining tool. These requirements is providing a sure plan that we don't know about. It is not a bargain. There's no scheming here.
Thank you, Vice Speaker. Minority Leader?
Thank you, Madam
have the floor.
Speaker. Again, if the governor doesn't act on these 4 measures here, then she can't have the curfew. So if that's not bargaining, I don't know what is. So moving
Minority
forward,
Leader.
no, I have the privilege, Madam Speaker, to speak my mind. And when I see something that looks this way, I have the option to say so. It's just an amendment that's going to be placed in here, and it ends up that the governor won't even sign it into law because of this amendment. Maybe that'll be good. But regardless, I don't want to hide by anything or just be deceivious from it, so I'm just going to object to this amendment, Madam Speaker.
Point of personal privilege, Madam Speaker.
State your point of personal privilege, Vice Speaker.
In according with our Mason rules, you don't attack the person or the characters or the individual's character. It was completely out of line,
Thank you.
unprofessional,
Point of personal
uncollegial.
privilege.
Thank you.
I still have the floor, Madam
Thank
Speaker.
Oh my God.
To call this a deception on the record, it's uncalled for. Every single one of us makes amendments and adds requirements to bills to ensure that measures are taken. This information is not that we're putting out here on this amendment. This information is not being given to the public. And I didn't know that we could tell the future whether the governor will or will not sign something. All I ask is to be collegial here and to be professional.
Thank you, Vice Speaker.
Point of personal
Minority
privilege,
Leader.
Madam Speaker.
State your point of personal privilege, Minority Leader.
Thank you, Madam Speaker. And Madam Speaker, what I said was just truth. What I said had nothing to do with offending anybody or anything. I see it the way it is, and I called it the way it is. So, thank you, Madam Speaker.
Madam Speaker, this amendment ensures that the people of Guam are brought forward if the governor should choose the need or should find the need to implement a curfew to attack this COVID-19 crisis. This virus is invincible. We see the previous speaker spraying her chair down and the desk because that's how serious it is with Lysol. So we cannot pretend like it doesn't exist.
Point of personal privilege, Madam Speaker.
But
you know, for me,
hold on.
spraying
Minority
down my
Leader.
desk with Lysol,
Minor-
I have a 91-year-old father. So
Min-
I'm taking precautions, Madam Speaker, because I'm here
Minority
for the
Leader,
people.
Buenas na fadais tigi KUAM News Update gifinut tomorrow para Merkulis. Diakin sige breed dos middanti. Manusia ni Navy na matay di marino gin ni USS Theodore Roosevelt. I marino ni tema identifika stig manitifika i familianya. Sa matay ginaibo hospital gilunis gin ni chanut COVID-19. Positibo ani mates gi diakin tagi matso. Duma poligi isolation na guma gi Navy base. Duma 4 otusiha na marino ni manina jilokwi. Gimapos na webes na masoda itaw to na tikumalalam tim za matsagi ma CPR. Ni otusiha na marino zani timi mediku wi hinaguma pas makonni para Naval Hospital zama PGG ICU. Sigoni mas nuevo na numero gini ni Navy 565 man ni nazi ni COVID-19. 3,921 man negatibo test niya za 4,000 na marinos sa man makonni huzing gi Roosevelt na batko sta halom gi itano. Gi mas news ibisinuta gi Norte Mariana sa man resibi 20,000 na test kit siya gi pangin Lunes. Sen nang kaluasti na respondo para inajuda ni CNMI po di COVID-19. Lenga gobyerno ni CNMI si Ralph Torres na 20,000 na test kit sa manggagi sa ipan sa mas pipa-impenyo para magsigi man matest itaw-taw siya in Sigidas. Anunsya gi dyan na plegong Facebook si Torres di pangin Lunes na naistabay gi plasan by Conairi. Lenga na estina ni Nai sa Sentinelaika ina na rin respondo para nasisti CNMI sa mafatsutsuy district chess semana na tempo tati para utay gwini humzom niya. Commonwealth Healthcare Corporation na CEO si Esther Munya pasangan ni KOM na matos tinakadya ginin South Korea sa rapid test kits STC ha. Ano mafaisang ko residente gwihi siya man matest na di drive-thru na prosesa gitiyang man na tempo ilingya si Munya na mafananan ST community-based testing para ma-identifika masanatan sa ma-contain. Ilingya naman matototso siya ni Senadette para manasiguro na tori tao-tao gwihi man matest. Adyo po siya mapuputso disti ani matos tinatsadnon. Sinya gait tempo sempri para offer matesto di manggay gwihi lo adzo mahanano gwihi. Maripopor ni Todi media siya gitano na para manafanano maski 600,000 na test kits ni South Korea para Estados Unidos ni requestan Presidente Trump. Adyo na report loki sa explica na FEMA sa mga kontrata na informatitan sa STC na test kits di sa Asia para fan matest Amerikano siya. Yaling nga si Munya na pareho adyo siya na test kits na naman mato sa ipan na di para fanano gato di sa Amerika. Giginin ma-report Director Departamento ng Salud Publiko ginamang gigi sa Guam si Linda Dinorsi asangani KUM News na 5 na test siya manafansasangi para CNMI kada dia sa dumada niya esti na di manafanhano esta gato gwihi. Ilang nga gobyerno ng CNMI na mananangatalo 40,000 mas na test kit siya para pago na simana. Dito ta at sa siyempre 60,000 na test kit siya man marisibi siyempre ni CNMI. Masangani KUM na esti na binida sa nina posible ni Zonya COVID-19 Task Force dyan ni CHCC. Gimas talo news si Dr. Hoa Nguyen ni member ni Physicians Advisory Group para mag-aaga asangan na sesana dahi higos at sigon na di dos ni mas nuevo na finitay COVID-19 ni unamko na palawan dyan nun marino a preba na esti na tsedno sa Texcoco haji para upuno. Timan diskriptima imin na 5 na finitay gimapos na sabal sa 69 andes na palawan anima miti gi Guam Memorial na hospital yung dia antes di umatay. Asangan si Nguyen ni KUM na anog na sensadig kinini haw no esti na tsedno pio dangin esta amko haw the guides it no tao esta nini na mas typhoid sa itataw tamo para unmumuji coronavirus. Asangan na sensadig finitay niya adyan amko so malum kipetan hospital za kinini gisigenti dia. Sentad kiloy dyan niya iman amko mortality rate lingin si Nguyen. Sinya esti na tsedno da distroso iminendensyamu gi minuto sa na tempo sinya kulan maulika sa nintemo pasisigida sa pinino haw. Masya gayi haw gi mas mauling na hospital gi sa California at so gusto na tsedno di sa Sonia sa pinino haw sanpri. Sinya banti gayi sa infection na dyan na amko ta sinya nanggaamam na tempo gi gumaniya ang tasyano para hospital. Lomegay siya na rason ni sinya pinino haw ni sensadig. Mentas sa Department of Public Health sa mga bibiso itaw-tawta na dadanggin ng suspect sa naninansiyo ni COVID-19 sagay gi gumamito zone self-isolate hanggang yung medico dadanggin anak na kulan ni Nazi haw ilig niya si Nguyen na siyempre si Su na matungo ni taw-taw siya gwin niya na situasyon na yan na debido na hanggang yung medico mo. Ilig niya mas nasangangan ni tenga iman malango na dadanggin lolo-luhaw da kulan nakataw na fanatan komposisyon mo pas marto'y tempo para na pa hospital. Adyo dupur siyon siya natan. Tanggit sinahaw komentos ni Cabales pas mamalika. Lo dadanggin tisinaw na fanatan komposisyon mo zon disitaw para naza sa kulan kadadahin na gong mo munga sa mga gigima hano para emergency room. Manakonsaya masin Nguyen na ti debi publiko na maungok kumampus. Adyo dadanggin ma-report ni public health na taza masorda na ni Nazi haneman mates. Enor siya na numero sa sen taybali giminagahit. Mga mancho na iluti no este sa sen magahit na irisutto sen mapod mataytay este na virus. The debi ta continue madahin may sahid. Haso na para tagan na este na tserno sa debi di ta konsigi ibidadata pago. Mento sa di na din ni gobyerno ni para mahutsong palo na kasada dan salan siya sa ni checkpoints. Jagwa siya man ni nabubo ilang si Nguyen na tipo di aturidad i gobyerno este na pot para isiguridad i publiko. Ilang mas si Nguyen na magugwi na di roadblock siya. Ilang na san megay na tao ti gumay sa este lo debi mo na haka sa dumatsogwi este so faninifesto si tao no fanyaga hagi gumaniya. Mananggagwi gitsalan 20 minutos ginigan niya sa parewa dan ginumano para airport sa marikonosi ang ni TSA sa para mana siguro na safo trabajo, pues por esta razón naguahan si roadblock. Para más news, ano para KUAM.com, kung Isla 63 padega y KUAM News, que masya hafa na cosas komunikasyon nila sa ZB. Para Guam News Network, Guausikin Conception. Fanyaga Yigumamizu.
President Trump is meeting this morning with people who have recovered from the coronavirus.
Thank you very much, everyone.
Monday, the president vigorously defended his response to the pandemic, even playing a campaign-style video during a contentious press briefing.
When you excuse me, you reported it. 0 cases, 0 deaths on January 17th.
The entire
January, I said in January.
The video has a complete gap.
On January 30th.
What did your administration do in February with the time that your travel ban thought?
A lot.
And the president asked Dr. Anthony Fauci to clarify comments about whether delaying social distancing measures costs lives.
The first and only time that I went in and said we should do mitigation strongly, the response was yes, we'll do it.
The president is expected to name a new coronavirus council today. The team will be tasked with advising the president on reopening the economy and country, a decision the president says is his.
When somebody's the president of the United States, the authority is total.
Chamorro news for our Chamorro audience out there. I got a couple comments. Thank you. You guys are welcome. I want to put that out for you guys. I like how he ended it. Stay home. 9:49. You know, we always try and end the show on a light note, and you know this is one of those mornings. Whew, I wish we had 2 light notes. So we're gonna bring Cyrus Lur. You know, a big part of this organization, PPE Guam.
Mm-hmm.
Good morning, Cyrus.
Morning.
Thanks for taking the call. We just wanted to kind of find out, maybe just round robin, talk about the different types of things you guys are doing with the group PPE Guam, because I know there's different. I guess I don't want to say factions. I can't think of the right word right now. There's different little subsections of the PPE Guam group, right? So just go ahead, take the floor.
Sure, and thank you for this opportunity. So what we're an entirely volunteer-driven organization, and we're trying to create personal protective equipment, otherwise known as PPE, to donate to frontliners, doctors, nurses, and those that are susceptible to COVID-19. It's an idea that kind of started just a few weeks ago, and in a short amount of time, it's really gained a lot of steam, and we already have well over 200 volunteers that are, some of them are sewing face masks at home, others have 3D printers and they're printing face shields, and we've already made donated a few hundred items to GMH, GRMC, Civil Defense, and it's just been very exciting to see such a strong community outpour of support.
For people who want to, help out, where do they go?
Absolutely. So they can reach us in a few different ways. We are on both Facebook and Instagram. Just search for us, PPE for Guam. 4 is spelled FOR, or go to our website, ppeforguam.com. And in both of those places, you can find out how to fill out a very quick questionnaire to kind of share with us whether you have a sewer, have a sewing background, or a 3D printer, or want to volunteer in other ways. And we can connect with you pretty quickly and get started. But by and large, this is something that you would be able to do from home. We are able to drop off materials, donated cloth, to people who can sew the masks according to plans that have already been approved by GMH and Civil Defense. So you can make them from home. It's kind of a way to be able to participate and give back without having to leave your house and violate a stay-at-home order. And so this is really a great way for people to be able to help those that are on the front lines and putting themselves at risk.
So, when people call and they volunteer, 200 volunteers, that's a lot of people want to help out. What are they saying, Cyrus, when they reach out to you and ask how they can get involved?
I think a lot of people are just excited that there is something that they can do. I think it can in some way, the example I like to use is that after typhoons, we always see the community come together and help each other out. But with this very sort of unique situation where, the best thing that people can do is stay at home and not sort of interact with each other. And so in some ways it feels very disempowering. We can't really reach out to our neighbors and help out. But this is really a way of being able to take back that power, to be able to enable people to take action from home that will have a very immediate and direct benefit to the front lines.
I think is interesting is that there was another effort that started early on, but I think halfway through they kind of had to retool and look at what they were trying to raise to make sure it was in line with what was needed. And you had mentioned GMH and was it Civil Defense? So you guys have had talks, and how did that conversation go?
It's ongoing. I mean, very, very positive. I think it is concerning for all of us to see that, Guam is not unique. We have this, in this situation, we have the same struggles here as anywhere else in the country when it comes to shortage of PPE. And so we are constantly discussing with them, what sort of things that they are short on, and we're trying to help out as much as we can. We do have a couple volunteers that have been working on creating hand sanitizer with partnerships with UOG. And our organization has been working with Department of Education, UOG, and others just to try to be able to do everything we can to come up with creative solutions for, last resort PPE.
And how creative are these sewers getting? I mean, are we just looking at regular masks, or are there any patterns in there? Because I've seen some with patterns. Asking.
Yeah, well, actually, there are some definitely creative fabrics that people are using, but they all look great and they're definitely safe. Everything that we're using is following standards that have already been either approved by the CDC or at least a major hospital or organization elsewhere. So these are tested plans that GMH and Civil Defense have approved and said that they prefer. But when it comes to style-wise, people can be as creative as they want when it comes to the fabric and such.
And so the fabric also, that's all being donated, right?
Yes.
So that is, you got shirts that were donated and
from Trenchtown,
Right.
So the microfiber.
Yeah, fantastic donation from them. We also do have a fundraiser on GoFundMe that has raised almost $10,000, and so we're using a lot of that to purchase supplies. We have purchased some cloth and sewing materials with that. We've also made a large purchase from Off Island for 3D printer filament, which we'll be distributing to the 25 roughly people that we have right now printing from home. And so that shipment should be coming in today. And so that's just a continuation of the process. And right now we have a goal of creating 500 sewn face masks this week between Monday and Friday, and 1,000 face shields, and we are about a third of the way there. So we see
you have an update here. First milestone update: 163 of 500 masks made, 326 of 1,000 face shields made.
Yep, and we're cautiously optimistic, confident that we can hit that by Friday.
Wow. All right. Well, thanks for calling in, and anything you guys need, just let us know.
Yeah, is there anything you want to add here in closing, Cyrus?
Thanks. Well, we can always use more volunteers. The more, your impact will have an immediate effect, helping doctors and nurses on the front line. And if anybody has transparencies, these are the overhead projectors, the plastic clear material that old-time overhead projectors would use, or maybe a report cover.
Hey, who you calling old time?
It's me, but I found when I explain it to younger people, they don't understand what
I'm who?
But overhead projectors, which I thought were very common, but are not apparently. But those plastic sheets, we really need those. Those go into, we use those for face shields, and we're finding a shortage on Guam. We've purchased some from Off Island. It's going to take about a week and a half to get here, but if anybody has some available, please contact us through Facebook. PPEforGuam.com. Just search for us, PPE for Guam, and please get in touch. That'd be a huge help.
All right, hey, Cyrus. Again, I just want to give you a big hand. You guys are definitely COVID heroes. All right.
Thank you, guys.
Okay, right. Cyrus Lure from PPE Guam. Jason popped all the info up there on the stream. It's a 9:56. Bree, can we just run through the days, the testing results, and the COVID? Sorry.
Sure.
Yeah, thank you.
All right. Okay, so public health, this was released last night by the Joint Information Center, 10:10 last night. Public Health on Tuesday tested 30 individuals for COVID-19. 0 tested positive through Public Health. 30 tested negative. However, 1 additional case was confirmed through DLS. Public Health's overall count also includes cases of COVID-19 that have been clinically diagnosed, confirmed positive cases by Naval Health Research Center in San Diego, and confirmed positive cases through DLS. So the total number of confirmed cases of COVID-19 on Guam is 135. And again, that number is inclusive of all the ways that Public Health receives test results. There are 66 recoveries and 5 deaths. All 64 remaining cases are in isolation. And of course, that is the latest information from the Joint Information Center, which was released at 10:10 last night.
Oh, there you go. Thank you, Sabrina.
You're welcome.
Hey, and thank you guys out there. Jason, yes?
Oh, I was going to say, Bree, you actually did a little segment. It's on our Instagram feed. It's on our YouTube channel.
Yeah.
It's on Facebook. People are raving about it only because you help them so much. Teaching Tuesdays.
Oh yeah.
This is trending now. Can you please hold this up to the camera, because this is the hand sanitizer that Sabrina. It's her DIY formula, and you can actually see the recipe that you use, and you actually walk people through the production of it.
Yeah. All it is alcohol, isopropyl alcohol, and you mix. It's 2 parts to 1, so 2 parts alcohol and 1 part aloe vera gel, and then you can add essential oil if you want to give.
What are some of the essential oils that you like to use, Bree?
Peppermint oil.
Right.
But I had thought I bought peppermint when I made this one, and it was eucalyptus oil, and the plastic part fell off, so it was more eucalyptus than tea tree oil. It was more tea tree oil than I was expecting to put in it. It just smelled so strong, so I tried to put in some eucalyptus oil to try and mask the smell, and it just got worse. But this is potent, and it's strong, and it's good.
But it gets the job done, and that's the most important thing. And somebody actually said they tried to make it, they followed along with you, but they didn't have any isopropyl at the house. They have no rubbing alcohol because that's really hard to come by. So they said they use vodka. I don't know if that's...
you can't.
Yeah, that's not a...
Yeah, somebody just threw that in there in Instagram comments. I mean, hey.
Hey, man, I got vodka at home, too.
Yeah, but I ain't going to be wasting no vodka and hand sanitizer. Oh. Anyway, yeah, that was awesome, Bree. And Bree is... she likes cooking this stuff up, these concoctions, and so I'm glad you're able to share that with the listeners. You are a COVID hero, Sabrina. All right. Hey, it's 9:59. Want to thank you guys. Hey, on
Out of water.
KUAM, point of personal privilege, on our KUAM TV 11 feed. Thank you guys so much for watching. And let's do it again tomorrow morning, 8 a.m. to 10 a.m. We throw the back half of the show on. Everybody on the KUAM News app and streaming on KUAM.com. Of course, right here on the radio, 93.9 FM, Guam's favorite, I-94. There's also an audio stream on Docomo Channel 10. And, of course, to our Facebook Live viewers and listeners from all around the world. And we did have a veritable United Nations of viewers this morning.
Yeah, appreciate all of you logging on and streaming us.
Yeah, there you go. So, actually, it's time to go. Remember, we take all the interviews from this show, cut them all up, and put them out on the YouTube. Mm-hmm. So if there's anything that you wanted to catch, a lot of people asking about that interview with A.G. Levin Camacho, that'll be up on the YouTube. And I'm pretty sure you'll see something about it on the news tonight.
Also, don't forget, 1 o'clock, we will be broadcasting right here on I-94 FM and on KUAM TV, the Governor's Daily Press Briefing. We're also streaming that live on Facebook. And make sure to check us out at 6 o'clock for prime time.
There you go. So it's 10 o'clock. We are KUAM FM in Hagåtña, Guam, I-94. I want to leave you with my boys and stay tuned. And 8 minutes of cha-cha medley. All right. For Sabrina, Guajosi Chris, this has been Containing COVID. Estadio!
Bye!